Do you have any audio back there? Okay, good. All right, good morning, everyone. So welcome to the meeting of the Tuolumne County Board of Supervisors. It's August 3rd, 2021. Before we begin, I just wanted to thank our hardworking public health staff. I know many of you have been following the news, and our COVID numbers have been going in the wrong direction, and so we do have a really talented team that has been doing everything they can to make sure that our public is educated, that they have access to vaccines and all of the tools that will keep them healthy and safe as we go through this. And so I've invited them here to lead us in the Pledge of Allegiance before we begin our meeting. So I'll have, if you folks want to stand up. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so if the clerk is ready, we'll go ahead and, Ms. Ryan, would you please read our public participation procedures, and then we'll go ahead and move into oral communications.
In order to protect the health and safety of our Tuolumne County citizens, this board meeting is open to the public with modifications. Face coverings will be required of all attendees regardless of vaccination status. During the board meeting, citizens physically present who wish to provide public comment will be invited to do so by the board chair. Citizens who are not present and wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment. Options for public access audio and video live streaming. The public will not have access for public comments via these media options. They are available for audio and visual only. Option 1, www.tuolumnecounty.ca.gov/745/board-meetings. Option number 2, access Tuolumne County at www.accesstuolumne.org and click Watch Live, or you can use Comcast Cable 8. Option number 3, Zoom webinar via your computer at https://zoom.us/j/98737385155, or you can call in at 1-669-900-9128 with your webinar ID 98737385155. Please note that Zoom webinar services tend to have a reduced broadcasting delay in comparison to the county and Access Tuolumne live streams and is suggested for the closest to real-time viewing and listening. Important public notice under the Governor's Executive Order N2520 and Order N2920, members of the Board of Supervisors can participate by teleconference. Accessibility requirements: if you need swift special assistance during the board meeting, please call 209-533-6581.
All right, thank you very much for that. So at this time, we'll go ahead and open oral communications. Our board values public participation and encourages community members to take this time to provide comment on matters of county interest. This section is for comment not related to items that are on the agenda. The public comment time limit of 3 minutes per speaker applies, and no action may be taken by the board on topics discussed. Our board members are listening very carefully to these comments and appreciate you taking the time to make a personal investment in our community. And so I'll go to the room first. If anyone would like to come up here and speak, now would be the time. Good morning.
Good morning. I don't know if you can hear me. Can you? There we go.
Yep, loud and clear.
I was a teacher for 30 years, so I'm used to this part. My name is Gary Johnson. I'm the director of the Volunteer Fair. And the Volunteer Fair is started as the class project of the Leadership Tuolumne County class.
So if you'll face the board, then
This
we'll
way?
be able to, yep, then we'll be able to see you better.
Okay.
Thank you.
And this is a third annual fair, and I wanted to make sure everyone understands this is a free event, and the purpose of the event is to match volunteers from our community with are nonprofit organizations. I just heard a second ago that, for example, Interfaith, Kathy Peacock mentioned that they are down 80% on their volunteers. So this is our opportunity to start building those numbers back up. Volunteers can range from children accompanied by a parent, all high school kids, which it's nice because high school starts the Monday before the volunteer fair. So we're going to hopefully get a lot of kids there, high school kids, college students, all the way up to our seniors. So it benefits our whole community. And of course, you guys all know the more volunteers we have in our community, the stronger our community. We currently have 62 nonprofits. We can hold up to 75. And our last one, we had 75. So I'm kind of hoping it'll be only 62. But if anybody knows of an organization that hasn't registered yet, they just go on our website, which is on this poster, TCVFAIR, tcvfair.org, and there's a registration form there. And as soon as they push submit, I get it. And it'll be from 4 to 7 on Thursday, August 22nd, or 26th, sorry. And we're asking the public to promote this event because word of mouth is the best way to get people there. So thank you so much for your time. If you have any questions, I'd be glad to answer them.
Thank you so much. Any questions? Thank you very much. And
I have posters here if anybody in the audience wants one.
great. Good morning.
Good morning. My name is Kenny Ayers. I live in Jamestown. I live in a,
So if you'll move a little closer to the mic, then the folks at home will be able to hear you. Thank you.
my name is Kenny Ayers. I live in Jamestown. I live in a senior community. And we've had some thefts there. The deputies were going to start doing some patrolling in our area to kind of deter some of the thefts. But recently, because of the wisdom in Sacramento, criminals are being let out faster than they can be put in. And our deputies are overworked. And earlier this year, somebody stole my motorhome from a locked, gated area in our area. And there was no deputies around because they are stretched and overworked. And unfortunately, some of them get jobs here just to pass through to find another job. We need to have some more money given to our sheriff's department so that they can retain and hire deputies. And that's my concern, is that we're not being protected because criminals got a free hand now. So anyway, I'd like for you to consider some of the money that's been granted to this county to go to
So
the sheriff's department.
I was kind of wondering if that's where you were going. We do actually have that item on the agenda. And so this is for public comment, not related to items that are already on the agenda. So if you want to come back and talk about the ARPA fund specifically, there will be a time for that.
I just wanted to voice an opinion.
Exactly. And I wasn't trying to stifle that. I wanted, if it's about the ARPA fund specifically, then we have to wait for that item on the agenda. But your comments about prior to that were general enough that we can certainly appreciate your concern. And I'm very sorry to hear that you've had those thefts on your property.
Like I said, the deputies were starting to do some patrolling in the area to kind of deter the thefts, but they're stretched.
Yeah.
We don't see them very often now because they are stretched and thin. So anyway, just an opinion.
Thank you very much.
Good morning.
Good morning.
I'm Steve Campbell. I'm a longtime resident and former business owner here in Tuolumne County. And I'm here this morning to address in part, our homeless circumstance here in Tuolumne County. I say circumstance for a reason, because I believe very strongly that homelessness is not the problem. It's the circumstance or the result of the real problem of substance abuse and mental health failures. And I hope that there's a way that we can, whether it be from the federal to the state and down to the local level, find more meaningful ways to deal with the prevention and not just with the circumstance that we have to deal with today, every day. I, as most people, feel very strongly that the homeless do indeed need help. I've been involved in that regard, in fact, helping some. It's clear that the situation we have developing at Resiliency Village on top of Big Hill is a situation that in almost every consideration suggests that it's not a very workable or effective location for such an operation. The planned use is not consistent with the zone permitted uses unless you consider the residents there to be agricultural workers, which has been expressed, by the way. And we all know clearly that they are not. They're there for supportive or transitional housing purposes, which is expressly included in the permitted uses up to 8 people. But once it exceeds 8, then a conditional use permit would need to be applied for. And that it has not even been discussed. Another issue, and perhaps the most emotional packed one, is fire. The access up and down Big Hill is very, very poor and limited. Getting equipment there is obviously very problematic. It's been suggested that that's a great site to shelter in place. In fact, residents of Big Hill have apparently a growing understanding after it's been mentioned that Resiliency Village would be a great place to shelter in place in the event of a wildfire. Even a letter to the editor suggested that with some comfort. And I think that if we allow that, or you allow that to persist, to me would be irresponsible. All of us need to listen to the fire and law enforcement authorities. And finally, the site is extremely inaccessible to the needs that they have, the services, the support needs. And that's not consistent with the practical needs that those people have. So, thank you.
Thank you very much. Good morning.
Good morning. Jason Revord from One Pile at a Time. We just finished up a cleanup up on Mount Provo over the weekend, approximately 80 yards of trash. We're finding even while we're doing these projects, these people are coming and dumping illegally, literally right down the street from us while we're doing projects. Something needs to be done. There's a California $1,000 littering fee. Can anybody tell me when the last time it was imposed? Anytime anybody's done anything about it? We need to really look at, instead of, we can't get blood from a turnip, so let's start getting these guys with community service. We're more than welcome to have them come out with us and they can do community service with us. But it's really now, over the weekend, they dumped a 55-gallon drum of an unknown substance across the road. This is leading into our creeks and streams. We've already discussed a few that are heading down towards Lake Don Pedro. We've got to do something. This is becoming, the more and more I search around and the more roads I drive, the more things I'm finding. Over the weekend, we kind of got called on something from, we weren't giving a checklist for what we could put in dumpsters. Obviously, we knew liquids weren't supposed to go into dumpsters. We didn't put those into dumpsters. We had tires in the dumpsters. We were actually told that we were to go and remove everything from 2 40-yard dumpsters and remove the tires. We got to think about this. We're just a group out here doing this on our own. And if we're having to do separation, that's it's the volunteers are they're getting put more at risk. So we just really need to concentrate on what's going down into our streams and our waterways, where these homeless are camping out. They're camping right alongside Highway 49, 108, right there by Wigwam Road. They're right on the creek. This is going down into Catalina, down into Lake Don Pedro, into Maloney's. We've got to do something. So I'm just here asking you guys, if we can put some more effort into this, as far as making people accountable for their actions. That's where it's all going to start. It's going to start on your guys' level. So that's what I had to say. Thank you very much for your time.
Thank you. Hello. Welcome.
My name is Jen Salazar. I'm also from One Pile at a Time. I live in Tuolumne, so I've been focusing on cleaning the roadsides in Tuolumne. So far, I've cleaned Buchanan, parts of Carter, Elm, Madrone, Cherokee. I cleaned all of Tuolumne Road. I'm 4 miles up Tuolumne Road North. I worked on Provo. I've done cleanups in all 5 districts. I've found hypodermic needles, drug paraphernalia, alcohol bottles, car hoods, windshields, tires, mattresses, wood, cardboard. There's plastic disintegrating. I've cleaned out ditches and culvert pipes, and all of that trash is going into the water systems. I've climbed down hills with ropes and pulled up tires that are just on the side of the road. People don't even see them when they're driving by. And the disheartening part is that after I'm done cleaning the roads, there's already trash there. So I just wanted to reiterate again that it's definitely a problem that we need to address. Thanks.
Thank you.
Bruce Erickson, Twainhart. I left some pictures for you to have a look at. These are tags that are on power poles. And if you look at them, they've got some numbers there in terms of when they were originally fabricated, et cetera. And there's some also numbers like on the first one that says 250. On the next one, it says 350, and that was done in 2002. And then the next one is 150. And it's hard to distinguish what these things mean. They're all made by the same company, however, and that's McFarland Cascade. Pass those down. This is merely a data dump for you to have a look at, because when PG&E talked about hardening our streets against fire by hardening the electrical system, they never actually set a standard. And it turns out that about 13 days ago, the new CEO of PG&E said, well, actually, poles aren't the way to go, undergrounding is, but they're still putting in poles in Tuolumne County. And I had asked Anaya, is he here today or on Zoom? We don't know where he is. Anyway, if you could leave some stuff on his desk too, that'd be great. It'd be really great to have him.
Bruce, I am on Zoom.
Pardon me? Oh, you're here? Great. Naya, we're leaving some stuff on your desk in terms of evaluating polls. So it's hard to tell, is a 1 better than a 2 or a 3 better than a 2? And on this third page of this McFarland Cascade, you'll see that it's got a very, very strange way to evaluate these polls. And it goes from 10 up to 1 and then goes on with H1 up to H6. So when you go down to 50 and you see, say we've got a number 2 poll, that means it's actually, there's only 3 worse grades of a poll, and there's about 8 grades that are better. That's what PG&E has been putting in. And if you look at some of the poll stacks that I sent you a picture of, that's what they've put into our community already. So what I'm asking you to do is have a look at this, and then you can make copies of this. These are original source documents from the manufacturer, and you can go ahead and start seeing if we have the right to tell PG&E now and push back on them and say, now that you've gone and put in polls and the CEO themselves have said that the polls are no good, let's get our undergrounding going and give them a real hard pushback. I'll tell you more about this, but in about 3 weeks, because there's some good stuff happening on this that I can't tell you about yet, but it's really important. One more thing I want to say about Dr. Surjanko here before I leave. That guy worked for us for a while, and he did a great job. I looked up his credentials and was impressed. Then he went away for a while. We got a full-time person. He came back to us when that person left, and he's been doing a hell of a job for us in a real hard time. I'm in the business, and I know the politics, I can't say enough good about him. Thank you.
Thank you very much. And yeah, that was my, I had a message to address that Supervisor Kirk is on with us on Zoom. So I was going to wait until you finished to bring that up, but thank you for addressing that. So we do have Supervisor Kirk on the line. He's listening and participating with us virtually. So, good morning.
John Flynn asked to go last, so since he asked me nicely, I will honor his request, sorry. And to tag on to Gary, the volunteer fair will be at the fairgrounds. And then regarding the trash, once again, I think that Waste Management should be held accountable for their pretty crappy service to everyone in Tuolumne County, whose areas they cover. And the other night, they found a used Sharp in front of the front door at Walmart. So Walmart, of course, doesn't have any Sharps containers. And the county has Sharps containers. They must be 40 years old. I haven't seen anything that old and out of date downstairs in the 2 bathrooms. And I know they're in the bathrooms at the park over by the library. I forget what the park name is. So we need to get rid of those and get some really effective, current, up-to-date Sharps containers. And I think we need to look at some kind of ordinance or suggestion or something that if you're a major business, you should have a Sharps container at your facility. I know a couple of department stores do, but they don't advertise it for their diabetic patients. But we should not be finding Sharps in the landscaping at the junction, in front of a department store, in our trash everywhere. So, where do you send people now? You send them to the casinos because they have current, up-to-date, modern Sharps containers that no one can reach in and grab stuff in their bathrooms. And then I would like to point out that several people have talked about covering their chains and preventing sparking and fires. And there was a fire, this weekend or towards the end of last week that started from sparking fires.
Thank you. Morning.
Morning. Hi. I'm going to give you this before I leave. After it. I got to do this. My glasses fog up. Is that okay? All right. 38 days from now, we're going to have the memorial of the 9/11 attack. And we lost a lot of good friends. We've lost a lot of Americans. And it was a big shock, like Pearl Harbor, December 7th, but it was a new generation. And this is not rehearsed, so I'm just winging it. And I want to thank all the men and women in law enforcement and civilian who, as teenagers, mid-teenagers, they became adult at 18, and they enlisted in the branch of the military they wanted, and they were going to take revenge and avenge the Americans who were killed on 9/11. And some came home. Bobby Rapp, Army Ranger, he never made it. He came down Washington Street. I was there for that. And there's nothing rehearsed here. So this is called the Constitutional Handbook, right here. And there's, I believe some of you don't even believe that in this oath whatsoever. You don't, but that's my opinion. But on the back of this Constitutional Handbook, I'm watching the time, celebrating the Constitution, and that's in 44 days. To commemorate September 17, 1787, signing the Constitution of the United States, Congress has designated September 17th of each year as Constitutional Day, and September 17th to the 23rd of each year as Constitutional Week. In 2004, Public Law 108-447, Section 111 was passed requiring the following. And I'm going to go down to the last one. So in keeping with these congressional mandates, recent presidents have solicited the help from federal and local governments, that's you leaders, as well as civic and religious leaders to hold events to commemorate the occasion. And I hope you do. And this is also mandated all federal buildings, and they have to, and each education institution that receives federal funds for each year shall hold educational programs. And that's constitutional. Each federal agency or department shall provide educational and training materials concerning the United States Constitution to each employee on September 17th of each year. And we got 3 times up. Okay. Who do I give this to?
Thank you. Can hand it to Heather and she'll make sure.
All right, thank you for your time.
Thank you. Okay, is there anyone else from the room that would like to speak? Okay, so I'll close public comment to the room, and then I do know that we have folks on the phone that would like to speak, so we'll go ahead and start there. Good morning. You're on with the board.
Good morning, Supervisors. I'm Chris Barsanti, a member of the League of Women Voters of the Motherlode, and I'm here as a member of the Observer Corps. Our purpose for attending your meetings and the Sonora City Council meetings is to assure transparency and accountability in government. So I just wanted to introduce myself and let you know that our intention is to attend your meetings as often as possible. Thank you.
Thank you very much, and much appreciated for the important work that you do.
Thank you.
Okay, do we have anyone else on the phones that would like to speak? All right, so we'll go ahead and close the oral communications portion of the meeting. Thank you very much, everyone that spoke. And then we'll move on to staff reports.
Good morning.
Good morning.
Debbie Batista, County Register of Voters. As hopefully everybody knows, we're going to have an election on September 14th. So I want to kind of talk about a couple of the changes for this election. Number one is that we're going to try and get the ballots out a few days earlier than required by law. So we're going to hopefully have the ballots mailed out the end of next week. And if not, they'll be mailed out on the 16th, which is the required date. Our office, like always, is going to be open. I'm going to start coughing. I hate masks. Our office will be open starting August 16th for early voting. Anybody can come down there. Originally, the state thought that there were going to be well over 100 recall candidates. There are not. There's just right around 50. So there is only one side to the ballot. I originally said you had to flip it over. You do not. Everything will be on the first side of the ballot. Sorry. I encourage you, even if you vote no, that you vote for a recall candidate, just in case your no is not the winning vote, so that you can vote for the next governor if there's a next governor. Please get your ballots into us as soon as possible because, again, this is a statewide election. We will start having vote centers opened, and our office will be the first one open that first weekend, which I think is September 4th, if that's a Saturday. And you can come down and vote in our office. We will be open Labor Day. Please come by and visit us. We're required by law to be open Labor Day. Again, the last day to vote will be September 14th. Since there's numerous board meetings between now and September 14th, I'll be back to talk about things that are going, like the last day to register to vote. But always remember, you can register to vote all the way up to Election Day, but you have to do it in person. Just as soon as you get your ballot, do your homework and vote soon or vote early to help us get the results in on Tuesday night, the 14th, so we don't get a lot of phone calls. Are you done yet? Are you done yet? Are you done yet? Thank you.
Thank you. And you said there are 50 candidates on the ballot?
You know, I was going to count before I came up here because they changed and they added. I think it's right around 50.
Okay. All right, well. Thank you.
Good morning, Chairman
Morning.
Campbell, members of the board. I am Kelly Schroeder, the Tuolumne County Ag Commissioner, and today I would like to let your board and the public know that my office, along with the Community Development Department, will hold another town hall meeting on industrial hemp. The town hall will be on August 10th at 6 p.m. on Zoom. And thanks to the efforts of Quincy Yaley, our Community Development Director, there will also be an online survey through OpenGov that will be available this week and open until the end of the month. I will be sending out a press release, post on social media, and email out to an existing list that the Community Development Department has to alert the public about the town hall and the online survey, and that'll have all of the details. And I'll also email the information out to your board. Thank you.
Thank you. Okay, any other staff reports? Okay. All right, so we'll go ahead and close staff reports and move on to the consent calendar. Ms. Ryan, are you ready to read the consent calendar? Okay.
Item number 1, approving the minutes from the July 2021 and the July 22nd, 2021 meetings. Item number 2, waiving the second reading and adopting an ordinance amending Chapter 2.24 and 3.20 of the Tuolumne County Ordinance Code related to purchasing, effective September 2nd, 2021. Item number 3, approving amendment number 2 with MGE Engineering, Inc. for engineering design services related to the Algerine Road Crossing Algerine Creek Bridge Replacement Project number 1719 for Phase 1 for a total amount not to exceed $263,855.10, authorizing the chair to sign. And item number 4, approving the reappointment of D. Keschner, Donna Phone, May Repete, and Pamela Oraba to the first 5 Tuolumne County Commission with terms to expire March 31st, 2024.
Okay, would any board member like to pull an item for individual discussion? Anyone like to comment on an item on the consent? Okay, I'll just kind of call out D. Keschner, Donna Phone, Myra Patey, and Pam Orba for really glad that they're stepping up. That's a fantastic team, every one of them. They've done a lot in our community for young people, so great to see that they're being reappointed to the first 5 committee. Okay, I'll look and see, is there any public comment on the consent? Okay, anyone on the phones like to speak? All right, I'll bring it back to the board for more discussion or a motion.
I'll motion to approve of the consent agenda.
I'll second that.
Okay, we have a motion by Supervisor Brandon, second by Supervisor Half. Call for the vote. All those in favor, I'm sorry, we're going to do a roll call vote because we have Supervisor Kirk joining us on Zoom. Are you with us, Supervisor?
Yes, sir. You got an aye from me.
Okay, so I'll ask Heather to read the roll call for us.
Supervisor Goldenberg?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Half?
Aye.
Supervisor Brandon?
Aye.
Okay, motion passes 5-0. All right, thank you very much, everyone. Okay, so we'll move on to our 9 o'clock appointment.
9 a.m. presentation and direction on the novel coronavirus COVID-19.
Okay, good morning.
Good morning. Good morning, Chairman Campbell, members of the board, Ms. Creel, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. Today we come before your board somber in how quickly this heinous disease is once again ravaging our community, specifically our children. Before this last month, we averaged about 18 new cases in children per month. However, in the last 30 days, we went from an average of 18 to 80 children contracting COVID, with 1 child requiring hospitalization. It is up to all of us to protect our children who do not have the option to get vaccinated. We can protect them through non-pharmaceutical approaches such as masking and hygiene and hand hygiene, or we can surround them by people who are vaccinated. Our preferred method is ours to decide, but at the end of the day, we must protect our kiddos. Today, we have a contingent of public health presenters because we have a lot of information to share. And without further delay, Dr. Surjenko.
There we go. Good morning, Chair. Good morning, Board. Eric Surjenko, Interim Health Officer. With me, I have Michelle Jaquetta, who will be driving the slides, and Christina Herrera, who will also speak to the education guidance that's come up since the last time we've met. And not working. Okay, we're going to need some technical assistance here.
Okay, I might have you talk a little closer to the mic so we can
lean in a little bit here.
We can hear you.
All right.
That's perfect. Thank you.
Okay. Okay, we got movement. All righty, excellent. So as Rebecca mentioned, it has been a significant month, and as I was mentioning to the other members of the board, is that we were expecting an uptick in cases. That occurs anytime that you have a relaxation of any of the guidance, and with the lifting of the blueprint of a safer economy and increased population mobility, that was certainly our expectation. That said, I don't think we were expecting the impact of the Delta variant, which has certainly taken a toll on the other states in the United States and is currently very active in California. So as a result, we've had 414 new cases since the last time that we have reported to the board. We have had a significant outbreak in the Sierra Conservation Center with 110 new cases there, and then 2 new deaths. In terms of this bullet, it was as of last night. As of this morning, I just heard from Dr. Hurd, is that there are up to 15 hospitalized cases at Adventist, 2 of which are on ventilators. And that's as compared to last night when we didn't have anyone. So again, seeing the severity and the impact of the disease, not only in the state, but in our community as well. Next, please. So this is reflected on the statewide, where you can see on the left-hand side the number of totally confirmed cases just shooting up, starting really the inflection point in the middle of July. We have not yet seen a significant uptick in deaths. It's slowly increasing, but again, typically what we see is our hospitalizations and deaths lag behind our onset of a disease by about 2 weeks. Next. I think this is the most telling slide in the entire slide deck. This is a product that our area coordination team puts together, looking at the regional snapshot. As always, Tuolumne County is the light blue, and as you can see, it's just, for want of a better term, screaming up there. And this, again, is concerning for all of us. That said, we're not the only county. Every county on that, in our regional view, has a significant increase in cases. Next. And go back, actually, when I was expecting and so we can expect this to continue. We've been talking to the state about models of continued transmission over the next 28 days. They do a 28-day outlook. They are confident that it will be at this same rate for about the next 14 days, and then after that, less sure, but continual upward increase in number of cases. So if you look at this graph, that dotted purple line is the threshold we would have to have, if we were still in the blueprint for a safer economy, get us back into the purple tier. And so I want you to think about all of the restrictions that existed at that point in time. Those would be tamping down this level of transmission. Those are not in place. Next. That said, we have seen a marked increase in our testing, but also our test positivity. Typically, rule of thumb is if your test positivity is over 8 to 10%, and we're at 10.7% test positivity, you are under testing. That is, you are missing cases in your community. So take this slide together with the previous slide, and you realize that we're probably missing cases in our community, and then that will reflect in hospitalization rates that we cannot anticipate with a great accuracy at this point. Next. This is our snapshot, our daily report. So we have currently 62 new cases as of yesterday, 216 active cases, and as indicated already, that currently hospitalized snapshot from last night is out of date. Next. I think this better reflects currently what we're looking at. This is the report by episode date, that is onset of disease or positive test, whichever is sooner. And we can see that explosive growth starting in the middle of July and continuing forward. The last 3 days reflecting August is to a certain extent data lag, and we can expect that to fill in over the next week or so as positive test results come back for those 3 dates. Next. So a little bit about the Delta variant. The thing that is driving this, also known by its viral nomenclature as B16172. It makes up approximately 75 to 80% of all sequences being done in the United States at this point in time. It is markedly more effective, about 70% more effective in spreading than the Alpha variant. There's a lot of discussion right now, and I don't think it's resolved on whether the Delta variant actually causes more severe illness or just the fact it's causing so many more cases that it is allowing for more hospitalization to happen just because of the sheer number of increase in cases. But we are seeing places like Missouri, places like Florida, they have exceeded their hospital capacities and are basically back to crisis standards of care that we saw back in January and February. That said, because of the increase in cases in the state of California, about a month ago, about 20% of all cases were being sequenced. Right now it's down to about 6%, and there's a significant delay where we're seeing a turnaround time of anywhere from 14 to 20 days. I want to acknowledge Paul Merrim, who's our county epidemiologist, has been working with the state lab and checking pretty much every day, hey, when are our results coming back? So we're waiting on those. We've got a number of them out. We have requested some as part of our disease investigations. I do want to let the board and the community know, though, is because of the nature at which this the lab is licensed, it is intended for public health use, and we cannot release the specific patient-level data to either a patient or a provider. Next. So the other concern that we have with the Delta variant is both breakthrough and reinfection. If we look at state-level data, the vaccine is still very protective. The overall case rate for the state for the week ending the 20th of July was about 13 per 100,000. But if we break it down into vaccinated and unvaccinated, the unvaccinated case rate is about 20.7 per 100,000, whereas for vaccinated it's 3.5. So a 6 to 7% or 6 to 7 fold reduction by being vaccinated. The same holds true for hospitalization, that you reduce the risk of hospitalization tenfold by being vaccinated. And then for this reporting period, there were no deaths associated with someone who is fully vaccinated. So I think this continues to speak to the value of being vaccinated. At the same time, locally, we have had 44 breakthrough cases of fully vaccinated individuals, making up about 0.21% of our fully vaccinated population. At the same time, we've had 6 reinfections, and I actually don't know the percentage of that, but I do think this speaks to the fact that we are seeing reinfections, that is people who had known cases November, January timeframe, who are coming back and having symptoms again. And we're probably missing some of these because people who have been infected, rightly so, think they have some level of protection, but just like we're seeing breakthrough cases, we can see reinfection cases. So again, want to get the word out there that there's at least the benefit of one mRNA vaccine, if not the full course. Next. One thing we did want to mention to the board and to the public is that our ongoing containment efforts focuses on case investigation and contact tracing. And I know there's a lot of details here, but realistically, the take-home message for our community is if you do become symptomatic, if you do become a case, if you are a contact, Please help us, help your community by cooperating with the process, because really, if we cannot effectively do contact tracing, we can't nip that transmission in the bud, and we have ongoing transmission throughout the community. So again, encourage everyone. It is not a punitive process at all. It is our way of making the community safe. Next. So again, just as a reminder, if we were back in the month and a half ago, this is what the map of the state of California would look like as far as tier assignments. Again, the blueprint was retired on the 15th of June, but right now we're seeing such a significant impact from the disease, not only in terms of cases, but also in terms of hospitalization. Next. So a little more about the surge. Again, swapping texts with Dr. Hurd this morning, we're already seeing more hospitalizations today than we did yesterday and having patients on the ventilators. That is similar to what we're seeing in the state as a whole, where you're seeing that uptick towards the end of the hospitalizations. ICUs, not so much. Not seeing that strain yet, but anticipate that will be occurring over the next couple of weeks. This slide is, again, a regional view from the Yosemite Gateway Area Coordination Team Episurveillance Unit. The blue bar is the data from a week ago. The orange bar is from this week just ending. This is hospitalization for COVID-positive patients in hospitals in our region. And so as you can see, as Fresno has essentially doubled the number of people that are hospitalized there. With COVID. Similarly in Stanislaus, seeing a 25% uptick. And what I'll say about those two areas is that's where we send our patients when they're really sick. So as an example, Mariposa has a 1950s hospital. So if they do not have to hospitalize a patient there, they fly them out or transport them out by ambulance. Same for our smaller counties, is that we send people down the road if someone is truly sick. And then if someone is very sick, they end up at Stanford, they end up on ECMO, they end up being on a lung transplant list. So again, this is that cascade of higher levels of care, and we're bumping up against that right now. Next. This is, again, some data from the Episurveillance Unit. In terms of percentage of patients that are hospitalized with COVID, we're right behind Lake County as a county with the highest percentage of cases, or not cases, but highest percentage of patients that are COVID positive. Again, as I mentioned, there's a state model. This light blue line reflects the consensus model or the ensemble model, whereas the green line is the lower estimate, the red line is the higher estimate. As we talk with Adventist Health Sonora, it is likely there will be beds available based on what they're seeing, but staffing is a challenge. Unlike the surge we saw in November through February, where they were able to get traveling nurses, other traveling staff, that has become more of a challenge, where those nursing staff are being given top dollar, $130 an hour or more, to work in hospitals in Missouri, Florida, et cetera, places that are already being impacted. I'll pass it over to Shelley for testing.
Good morning. Just an update on testing. Continues to be available through our some local providers and some of our local pharmacies. At Adventist Health Sonora by referral, and by referral meaning contacts who've been identified of positive cases are given referral to Adventist Sonora. And of course, for symptomatic folks that show up to the ED or to Rapid Care. Our state testing site, which is currently at Tuolumne Memorial Hall, we do have plans to relocate that back to Sonora in the middle of the month, and we will provide more details as those are confirmed and provide updates. It's currently open Sundays, Tuesdays, and Thursdays from 7 to 7. And beginning next week, we have asked them to increase the days in response to the surge that we're seeing, and so they will. The hours will be expanded from Fridays through Tuesdays, just being closed on Wednesday and Thursday, same hours, 7 to 7. Walk-ins are available, but appointments are always recommended. That's at lhi.care/COVID testing, or the phone number there, 888-634-1123, and there's no cost to the individual for the testing at the state site. Again, testing guidelines, we recommend you getting tested 5 days after travel or any known close contact or potential exposure to a case, as soon as possible if you're experiencing any symptoms. And every 14 to 28 days if you're regularly working with the public, and that's even if you've been vaccinated. And in a couple of slides from now, we'll be talking about the testing guidelines in accordance with the state health officer order. And so talking about vaccinations, this is the most recent snapshot from the state vaccine dashboard. It's covid19.ca.gov, and there's a vaccination progress button where folks can follow. And this is the snapshot by age group. So you'll see we're still hovering around that 70% fully vaccinated for folks 65 and over, but our other younger age groups still have a significantly lower vaccination rates. The box at the top, I know there was a little bit of confusion last time, includes the doses, the federal doses. So the state dashboard does not include federally administered doses. So when you incorporate the numbers from federal doses, our numbers are a little bit higher, so that we're at about, still though, only 52% of our total population, eligible population, that are vaccinated. Do you want to add anything else there? Okay. So we want to talk a little bit about our vaccine efforts. Public Health does continue to offer vaccination clinics in addition to the pharmacies and other providers that are, and clinics that are providing vaccines. We're doing so at the Public Health Department, and we've been doing mobile vaccination efforts for some time. And have actually increased in the last couple of weeks. We've done mobile vaccination efforts at areas such as Camp Hope, at the Enrichment Center and the Lambert Center, and go out to schools. At the Atka Food Bank sites, we go out and reach homebound individuals. We've gone to the Columbia College, out at the jail, in congregate living facilities, and at businesses who've requested us to come out, such as Rush Creek and Evergreen Lodge, and out at Hetch Hetchy. And those have been really successful mobile efforts. And we would encourage any organizations, businesses, or communities that are interested in having us host a mobile vaccination clinic to call us at 533-7440. That's our call center line. And as long as we have resources to continue doing this, we would like to continue to do that and offer that to our community.
All right, and I wanted to, given the number of orders that have come out over and other recommendations over the last month and a bit, felt it would be worthwhile to review these. Is, again, with the retirement of the Blueprint for a Safer Economy, the state health officer order was put into place that mandated mask wear for unvaccinated people, but did not require mask wear indoors for people who are fully vaccinated, and no mask wear for anybody who was out of doors. Given the increasing cases that we saw the week preceding the 22nd of July, I went ahead and issued a recommendation for those who are fully vaccinated to go ahead and resume masking indoors as a means of reducing the transmission of the Delta variant. On the 26th of July, the California State Health Officer did a public health officer order, and what that specified was that there would be vaccination verification required for employees who are in healthcare settings, congregate living, and congregate living also included correctional facilities. It directed that those who were in those settings who were not fully vaccinated to go ahead and do weekly testing as a means of risk reduction. I will say at the same time, and I didn't put that bullet up here, is that the state of California, as an employer, ordered that their employees do the same, which is to verify their vaccination status, and if they were not vaccinated, to go ahead and do weekly testing. And then on the 28th of July, last week, the CDC, looking at data from an outbreak that occurred in Provincetown, Massachusetts, recommended masking for fully vaccinated individuals. And a little bit about this is that they looked at a large cluster, essentially a super spreader event that occurred at a bar, very crowded, no social distancing whatsoever, probably not a lot of masking, if any. And what they saw is that there was significant transmission, and there was likelihood of transmission by vaccinated persons as well as unvaccinated persons. Looking at that same outbreak, the California State Health Officer issued a similar order that updated the original masking order that came out on the 15th of June that recommended masking for fully vaccinated persons as well as continuing the mandate for those who are unvaccinated.
Good morning. I will provide an update on how the school opening process is going. As a quick recap, Tuolumne County Public Health and all superintendents, as well as the County Office of Education, meet weekly to update superintendents and school staff on the current COVID situation and any updated state guidance. We continue to do that and have began providing assistance on the newly released school guidance. The link for the new guidance is on the next slide. A 2020 recap, so most, if not all, schools in Tuolumne County were open for in-person instruction, with many moving to a hybrid or distance learning model during the November to December surge, and then resuming again in in-person instruction. We saw sports come back, band come back, and many other events resume again as well in the spring. And this is largely due to the ongoing coordination between each school district, the County Office of Education, and Public Health to conduct rapid contact tracing when there is a positive case in a school setting. We continue, like Michelle and Dr. Surjenko said, to experience challenges with containing outbreaks and containing the spread of the disease in schools if parents and families are not forthcoming with information. So we encourage families that if you are a case or have been a contact, to disclose that to your school and to public health. That way we can ensure that we can stop the spread in school and keep students and teachers in the classroom. Both the County Office of Education, schools, and Public Health have received funding through AB 86, which will continue to support staff to coordinate contact tracing, case investigation, and increase testing capacity. We'll continue to review facilities use and sports plans. At this time, the state has not released their updated youth sports guidance, but we are waiting for that, and we'll provide assistance to schools and all community sports and recreation groups as that comes out. Due to the coordination we have with each school, we found that any outbreaks, so an outbreak was defined as, I believe, 3 cases within a 7 or 14-day window in a school, that none of those outbreak investigations in our school resulted in any school transmission. And that is due to rapid contact tracing that we were able to do at that time. Next slide. There is a very helpful website. It is the schools.covid19.ca.gov Schools Hub. This houses all of the information schools related with regard to the science on masking that the state is using, all the guidance documents, tools for parents, teachers, and community members if they're interested in schools information. The link there on the second bullet point is the updated guidance. The highlights from that is that schools going into the 21-22 school year will require indoor masking regardless of vaccination status. There are updated and targeted quarantine and return to school scenarios that support continued in-class instruction. So different from last year, there are more opportunities for students and staff to return to school if there is vaccination and appropriate testing in place. And we are also, schools remain required to report positive cases to public health and continue contact tracing efforts. We are working with each school district to assess their testing capacity to ensure that they have both rapid testing and PCR capacity going into the 21-22 school year. Due to AB 86, we have been able to increase our staffing in our schools unit, and so we have more public health staff available to provide assistance to all of our districts when schools start here in about 2 to 3 weeks. And by that time, we hope that each district also has their safety plan in place, has a testing strategy in place, and are trained and ready to go on what the quarantine and contact tracing modifications are. That being said, the school guidance is designed to keep schools open and keep students and staff in school. We strongly encourage those who are eligible to get vaccinated to do so. That will help keep our cases down and will help keep our classrooms open.
Okay.
Not sure. Okay, I'll take this. Well, thanks to Dory for supporting us in the public information role for the public health response. We do have a PIO email that's phpio@co.tuolumne.ca .us that can be utilized for media and public inquiries. Also, our Tuolumne County Public Health Call Center remains open at 533-7440. We continue having weekly press briefings with our local press partners on Friday mornings, and that continues to be a beneficial partnerships, and we thank our partners for that. And we are having a COVID update on Facebook Live this evening at 5:30, so we encourage anybody who has time to jump in on there. Dr. Surjenko will be joining us for an update and to do a bit of Q&A, and I believe Supervisor Campbell will be joining us as well. And then our final slide is just, again, our contact information for questions. As our main line is 533-7401, our COVID call center 533-7440, and our email health@tuolumnecounty.ca.gov.
All right. Thank you, Chair. Thank you, Board. Pending your questions.
Okay, questions from the board? Start over here. I guess
Thank you for your report. I found it especially sobering to hear that we have 2 people in the hospital on the ventilators. That's scary. And I hearken back to originally when so many people got put on ventilators at the beginning of this pandemic and passed away. And I'm wondering what our hospital and what the protocol is now with all of the research that is in. I know that monoclonal antibodies have been a lifesend. In fact, they saved my 35-year-old nephew, who's ex-military. Without conditions, he would have died without those and without a combined treatment using those. And I also know people who have successfully used ivermectin, and the studies around the world now show that it's very effective at used in combination. Just like with HIV, it needs a cocktail. It needs more than just that in order to be effective. And I'm wondering if there has been any kind of loosening up of the AMA restrictions regarding generally recognized as safe drugs like ivermectin, and there's a couple of others that have been used more or less effectively, but I think ivermectin is the number one as far as the 3. So I just would like you to speak to that. I think that the public has not been included in this information, and I really don't understand why, because it does mean lives, and it's concerning to me.
Yeah, so Supervisor Half, going to the first part of your question about MAB, monoclonal antibody therapy, is that is available to hospitals, and if they cannot get it through their regular network, that it can be requested through the Medical Health Operational Area Coordinator, MOHOC, to the state. So that's something that's a recognized and beneficial therapy. With ivermectin, I concur with your assessment. I think it's a little bit too early to say it's a silver bullet or a golden bullet. I will say that the largest study that was conducted in Egypt was retracted because of flaws in their data, and actually it sounded like they confabulated some of their data. So what we're seeing now is that there were a number of meta-analyses that were done based on the numerous studies that were out there, of which the Egyptian study is the largest. And so if you take that big hunk of data out of the meta-analysis, they no longer become effective. So I think what we're at a pause, right? Or not at a pause. We're at a point where those well-constructed studies are underway. I am hopeful that it will demonstrate benefit, but at this point, with the loss of that flawed study, it's hard to say. So stand by at this point.
Okay, just to be clear, I was not referring to the Egypt study. There have been studies all around the world.
I know, and I'm aware of them.
Okay.
And the same holds true, is that when you take those smaller studies, put them into a meta-analysis, it's still this overwhelming number of cases that come from the Egyptian study. Take them out, you lose statistical significance, and then the relevance, it brings into question whether it's a valid therapy or not.
Well, I remember asking my doctor if I could get a prescription for it as a prophylactic
prophylaxis back when COVID started, and I was told no. Have those restrictions been?
So there's no restriction on if your provider wants to do off-label prescribing, they certainly can do it, but that's the judgment of that physician or provider.
And the pharmacists aren't denying those prescriptions?
Not that I know of.
Okay. That was my understanding originally, so I'm hoping that's not the case now.
No, so hearkening back to hydroxychloroquine, there were challenges there because there was such a low supply that people who actually would benefit from it on their regular basis for other medical conditions were unable to get it. So that was concern back in March and April of 2020. But ivermectin is so rarely used, typically as an antiparasitic, as you probably know, that there isn't that huge demand. So supply chains, again, cranking it up. But I do think there's enough question at this point, especially with the withdrawal of the Egyptian study, that we'll just have to wait.
Okay, thank you.
Well, thank you for the presentation, pretty sobering. Not much positive information in there, unfortunately. If we could go back to look at the slide, I'm not sure what number it is, but where it showed the number of people vaccinated by age group. Oop.
There you
Here we go. So a couple of questions on this slide. Is that the 12 to 17 group? It's hard to tell how many of those have been either partially or fully vaccinated. Is it roughly 25%?
It's about 25% that have either been partially or fully vaccinated. If I were going to guess, I would say it's probably 5%, reaching the little wedge, it's probably about 5% that have been fully vaccinated of the 12 to 17.
Okay. No secret and pretty much known is this problematic 18 to 49 group, right? We've got roughly 35% vaccinated, to one extent or another, 28 fully and 6, with the single shot, I guess. I guess one of the questions is there's been a lot of discussion about the full approval of the vaccination versus the experimental or whatever it's called, classification. There was some talk about Pfizer perhaps being close to being fully approved. Do we have any?
Right. So the phrase you're referring to is the Emergency Use Authorization, or EUA, I have to be cautious about not saying experimental because it had to go through all of the processes that are required for a vaccine to be approved through stage 1 through 3 trials and then approval by the FDA. The only thing that's really missing is that long-term, up to a year, seeing if there's other things that happen, such as what we saw with J&J and thrombotic events, and with the Pfizer and myocarditis. So, recognizing these very infrequent and then being able to capture that data is important for full use authorization. And my understanding is, Pfizer has submitted their package to the FDA. The FDA has the data, is reviewing it, and we are anticipating somewhere around now, to be honest. So, the two questions that are outstanding are when will full use authorization come out for not just Pfizer, but the Moderna and Johnson & Johnson vaccines, knowing Moderna has also submitted their package. And then the other question is Pfizer and the 12 and younger group. With the full use authorization for Pfizer, again, I would anticipate that within the next month. Realistically, it could be next week. For the 12-year-old and younger, what we're hearing is that may be longer in process, as there's back and forth between the manufacturer and the FDA on what data that the FDA would like to see to ensure that it's safe and effective in this age group. So it may be as late as the end of this calendar year, which is a disappointment, but again ensures that it's a safe and effective vaccine for that age group.
Okay. You identified, since July 2nd, 414 cases, additional cases, but in reality, pretty much in the last 10 days, about 375 of those by, rough calculations that I did. So that's a huge jump in the very near term here. The hospital, 11 yesterday, 15 today, 2 on ventilators. Just the amount of people with the breakthrough, the 44 and 6 being reinfected, these numbers, just keep going up. And it really comes back to looking at these vaccinations more than anything else. And I think we saw, this last Friday, we had some increased numbers of people that got vaccinations, with what public health did, I think about 65 or so Friday, which was good. But, if we could just get people, to get vaccinated, I mean, that, just the outcome from that is would be extremely positive. Let me look at my notes here. Glad to see that we're gearing up to increase the testing, essentially going from 3 days to 5 days a week. I think that's important. I myself have been lax in getting retested, and I think I need to do that. And if it moves back to a Sonora area, I think there'll probably be the accessibility for people to be more likely to do so. Just numbers in the hospitals, Fresno and Stanislaus counties. Like I say, if we had a time period, where we had patients that we were flying to Reno and also sending them to Valley hospitals, and the more problems that, all of these areas have, it just compounds it. So, I just, for anybody listening and the public here in the board chambers, the getting vaccinated, pays tremendous dividends. We just can't stress that enough. Our public health people are stressing it, and people just really need to step up and do that. Do it. If you're not going to do it for yourself, do it for your children, do it for your parents, do it for your grandparents. Don't be self-centered about this. Get vaccinated. It's just so important. Thank you very much.
Thank you. Supervisor Brandon?
Yeah. Just piggybacking on to what Supervisor Goldenberg mentioned too, looking at some of these numbers, I think you were going into it, but for those who are vaccinated versus those who are unvaccinated, let's see, where do we have that? I believe it was about, 14 times higher, I think, for the hospitalization rate. It was something like 7 times higher for the case rate for those that are unvaccinated, and currently no deaths from anybody who was vaccinated.
Right, for that reporting period, yeah.
Right. And, just to back that up, that's the easiest way to make sure we're not only protected as a community, but as you mentioned, if there was a color tier system right now, we would be in the strictest state implemented form of lockdown. The state could, at some point, decide to implement some other system like that again. And that would have a huge impact on our economy and our businesses, especially, as we're trying to pick ourselves back up and recover. So please, get your vaccine, get tested, go to public health. If you have any questions, they've been very responsive. I know you got, I think, a whole team of people locked away answering phone calls and everything, right? All, I think, 5, 6 people, just there to be able to help you with any questions you have. With that, I want to say, great work. Thank you for everything that you're doing. I know there's been a lot of discussion online in particular about what's the county doing. I think, moving and implementing the tool of masks, that's something that's an effective tool. When we had our case rates down, we got rid of that. It was something that at Public Health's, discussion with them, it was a tool for a problem. The problem didn't exist. We didn't have them anymore. And here's the problem again. This is, I think, the most minimal thing that we can do to try and maybe remind people that we're not out of this yet, and hopefully stem the, this getting any worse. So with folks that are out there too, if you're having big things planned, if you're going to the grocery store, please just, get those habits that you were working off last year, dust them off, get the hand sanitizer out, start fist bumping, wear your mask, whatever it is. I know it sounds silly, but it really does make a difference and helps ease the burden there. One last thing, and I just wanted to say too, is be careful of what we read on social media as far as any medical trends. There's a lot out there. Science is very complicated. We got to make sure that the data is accurate, that it's shown, across multiple tests. You can't get a prescription for a lot of times antibiotics or these other things without a particular cause. It's not uncommon. there are dangers, I think, of bringing some of those things up. Some of these are animal products that people may go try and buy because they don't want to go through a doctor and get a large dose. If it's an antiparasitic and it interacts with something you may be on a blood thinner or other medication and you haven't talked to a doctor about that, that can damage somebody and it can hurt them if you use the medication inappropriately. So my recommendation is talk to your doctor, listen to our public health staff, make sure that it's not just something that sounds good, it's actually verified by the people that we trust to protect us. My only last thing was just a question about the testing site moving from Tuolumne. So is it my understanding still that that will be at the Sonora main branch of the library in the AV room?
No.
Okay.
No, we're looking at another site that will be strictly be able to be used for testing and vaccinations if that ramps up and we're unable to absorb that at public health. So no, it'll be a separate retail or a leased space.
Great. I really appreciate that, and thank you for the consideration of that. There's a lot of groups that use that room, and I really appreciate that. So, thank you.
So could you go back to slide 31?
That one.
So public health recommendation and state public health orders. There, that's the one. So, and actually maybe the previous one too. So so we have to do something. Clearly we're trending in the wrong direction, and I could point out that line graph kind of tells the whole story. Our county is shooting up above every other county in the region. And, you mentioned the state health order for state employees. My understanding is an order for federal employees as well. Oh, and I'm sorry, I did skip over Supervisor Kirk. I just saw my phone light up with his name. So I haven't forgotten about you, Anaya. Apologies.
Oh, go ahead, Ryan.
I did jump out in front of you. Sorry about that. But I'm just going to go ahead and continue. So what are some of the other practices that are being done by state government for state employees, federal government for federal employees? Are other counties adopting some of those more strict employer guidelines? Other counties and cities in the state? And my guess is that counties throughout our region, because boards of supervisor tend to meet on Tuesdays, are having this exact same conversation right now throughout the state. What are they talking about, and what are the options available to us to help stem the tide, at least from the perspective of the county as an employer?
Right, and I think that's the important way to think about it, is that the state as an employer, not as a government mandate, required testing or vaccination of their employees as a workforce protection. So again, our role as an employer is to ensure a safe working place. And so we're seeing that in the federal government. So again, our partners in the Forest Service, Park Service, Bureau of Reclamation are doing the same level of either testing or verification of vaccine status. And then we're also seeing this extend into local governments as well. I know 7 or so cities and counties have already adopted this or are adopting this. And then a number of others, as you indicate, Supervisor Campbell, are looking at it, discussing it as you are. Obviously, different settings, but the largest I know is Los Angeles County is considering this. But Yolo, Sacramento, smaller jurisdictions are as well. And then again, from the perspective of an employer, there are a number of companies that are implementing it or considering it for their employees. So on the health end, Kaiser is mandating vaccination for all of their workers, regardless of whether they're healthcare workers or administrative staff. But other companies, big ones like Google and Facebook, are implementing it for their employees as well that are coming into the common workspace. So what we're seeing that from an employer perspective, protecting the workplace, what I, as a retired military person, see as force health protection. That is, how do you ensure mission by having your workers safe? Those employers are seeing vaccination as a good force health protection measure, or a good measure to ensure workplace safety. And in lieu of vaccination, ensuring that there's, reducing the risk of transmission by having testing required at least weekly. And so that's kind of the model we're seeing, not just in government as employers, but private business as employers.
So what would it take to, what would be the process if we were to go down the road to look at implementing some version of the state employee guidelines?
So that's something I would defer to human resources, but again, it would require verification that mechanism exists in place. I don't know if the county administrative officer has thoughts along that lines, but again, something that could be done.
So there's the first step would be getting clear direction from your board if that's what you would like to do. If you do want to do that, then we would need to meet and confer with each of our bargaining units about the impact to employees. And then we would then lay out the administrative process and to begin requiring that people either be vaccinated or verify vaccination and then be tested weekly. And we'd also need to work with department heads about the impact for the number of employees who would need to be leaving the workplace in order to, actually get tested, which would be during work time. And then I don't know if Sarah wants to weigh in with anything additional. No.
Okay, so if we were to go down that route, that wouldn't be the end of it. We would have to work with the different bargaining groups to find something that they would agree on.
Supervisor Campbell, I just want to clarify. So your board has sole authority to mandate a vaccination proof, so showing proof and or doing the masking and the testing. But what you would do with the bargaining units is meet and confer regarding the impacts of that. So for instance, how long it takes for them to show that proof, or when they get off work to go do the testing, that kind of thing. But the actual decision to implement that is your board alone.
Okay. All right. So Supervisor Kirk, you've been waiting patiently. Again, apologies for passing you over. Did you have any questions for our public health staff?
Sure. Couple questions, couple comments. So Dr. Sujenko, first of all, with the ICU surge plan, Adventist Health said there's beds available. I understand when we went through these roller coasters the last year and a half, they were in good shape. But I am hearing, a big part of their concern is staffing. So my question kind of comes down to demographics. When we look at the people who are vaccinated, and I think it said 70%, and then I think 8% more had one test. So let's assume they get their second shot, or not test, shot, but so say we have 78% of people 65 and older get the vaccination. Do we expect, because of those demographics, that if we do get more cases and if we do get more exposures and whatnot, that we could see less people in hospital or less serious ICU issues if we move into what some of the projections are showing?
So if I understand your question correctly, is, we're protecting our most at-risk patients, our most at-risk residents, by ensuring that those who are 65 and older are vaccinated. The two concerns I would have with that is, as we're looking at data from Missouri and looking at data from Florida and other locations where they're seeing that uptick in hospitalizations right now, is really the demographic that's growing in hospitalization is the 20 to 50-year-olds. They aren't dying as much. They're still dying, but they're in the hospital consuming resources until they are recovering. So that's a demographic that probably would benefit from vaccination for their own protection, but also recognizing that we've demonstrated that vaccines decrease transmission, something that we've developed data over the last 6 months on. And so knowing that 20 to 50-year-olds actually are probably the best spreaders of disease, having them vaccinated to decrease transmission is important as well. So I think, again, it's not so much which demographic, but how much of the population that we can get vaccinated to reduce transmission throughout the entire community.
Okay. Do we have any data on those 25 to 50-year-olds as far as ICU or just hospital?
So I do not, I don't know if Shelley does, but we can get that for you. But I do know that we have people that are in their 50s that are hospitalized and in their 40s.
Okay.
And yeah, Shelley indicated
if we
younger. And
could
actually,
get
we
that.
actually had a minor who was hospitalized. And again, for our county, that's, one is significant in terms of total number.
No, absolutely. I'm just looking at it from a surge capacity point of view, moving forward. Curious if we might have.
I think, again, we're meeting with Adventist at 2:00 today to as we've done every Tuesday since the beginning of March 2020. And I think our conversation today will be very much focused on, again, staffing, making sure that a bed that is available has a nurse or a technician to go along with it.
And then let me see. First of all, I didn't open up. Thank you guys for, people have their different opinions about the vaccination, but I thank you guys for making it available for those who want, going around to businesses, going around to Hetchetty. I think if that's something we can continue to do, I definitely support that. I think it sounds like we're going to have a discussion here in a minute with the board about where we want to go moving forward if we're going to implement the state mandates or their recommendations. I simply want to remind this board that this comes down to a personal decision to get vaccinated or not. And if we're going to start going down the road of repercussions or talking about employment hinging on whether people are vaccinated or not, I think it's going to bite us in the butt big time. Not only is it a constitutional violation to mandate somebody inject something into their body, but we're now violating people's personal choice. So I think we should be mindful of that. If we're talking about our county employees, we have 54,000 people who reside in our county. And if we have about 600 employees, that makes up only 1.1%. So I think we should be very cautious moving forward about how we interpret what the state is doing and what we're going to do locally. And I think the best thing we can do is support public health outreach in their message, but then at the same time respect people's personal rights and their personal choice. So I will leave it at that.
Okay, thank you. So I'll go ahead and open it up to public comment. Is there anyone from the room that would like to speak? Yeah, come on down. And then just before, is there anyone on the phones that has called? Okay.
Right. What Anaya Kirk just said is all correct. Public Health Department, Dr. Sachenko, and the board, you cannot suspend constitutional liberties. You have no authority whatsoever. As an individual private citizen, this individual right over here, he's private. We do have the legal authority, if we wanted to, and you were in complete, to place you all under citizen's arrest and call the sheriff department immediately. We don't call the police, we call the sheriff. There's a reason for that. Not going to go into that. So, number 12, how to say no to the needle. 25 facts you need to know by Peggy Hall. www.thehealthyamerican.org. Number 12, no CDC guideline, OSHA regulation or health officer order can suspend your rights. Illegal under the Constitution. We do have rights. That would fall also under the Fourth Amendment. All persons are of the Bill of Rights. All persons are to be secured in their persons. That means if they don't want to have a shot, they're secured. You can't put a shot in somebody. That violates the Fourth Amendment right there. Then you have the Fifth Amendment, without due process of law. You all swore an oath. Then you have the Eighth Amendment. No, there'll be no shall there be excess bail, fines, or punishment. Then you have the Ninth Amendment, and that's a enumeration of the Constitution of rights from other states. And then you have the 14th Amendment, life, liberty, and personal property without due process of law. You got to go through the proper procedure. I'm winging this again. Dr. Sachenko cannot suspend my constitutional rights. I can place him under citizen's arrest for committing domestic terrorism, and I will not hesitate to do that. I will call the sheriff department. You don't have any authority to do that. You all swear an oath to the Constitution. You got to adhere to it. We have, I don't know if I'm going to, shutdowns are illegal. Shutdowns are illegal. It's by Peggy Hall. She's been doing this for 18 months. And I was looking for an attorney back on July 17th, and I went to YouTube, and I'm punching lawyers suing county officials on COVID-19. Peggy Hall came up, Orange County. Look it up. Thank you.
Thank you. Any other, would anyone else like to comment?
Well, I would disagree with Mr. Flynn, and I don't have all the facts, but I believe there was a Supreme Court ruling about smallpox, and maybe Dr. Sachenko would know that better. So you made, Supervisor Brandon, made the comment about talk to your doctor. So I see a lot of Adventist health workers. So from them, I'm hearing, and it's anecdotal, that they have a less than 50% vaccination rate. So that scares the crap out of me. I don't want to go to a hospital where they're not safe. And that their doctors, I've had people tell me their doctors advise them not to get the vaccine. So I have a lot of concerns about that. I went to the testing site out at Tuolumne a week ago, and I was very impressed. That's like the best one I've been at. I'm concerned, though, about the messaging and how the messaging has been muddled and confusing for a long time. And I've had, I'm confronted by hostility every day. Well, I'm vaccinated, I don't have to wear a mask. Or you can't tell me what to do, or you're going to violate my constitutional rights, and blah, 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 blah. So I don't think it's helpful to get emotional, and I don't think it's helpful to indulge in shame and blame. So we have to find a way to talk so that everyone can listen. And getting the vaccines is a choice, and you have to make it their personal decision. So somehow we're failing to listen to people on why they are so resistant and what their resistance stems from, and then giving the information on how important it is as a community to make the decision to support the community over yourself. And vaccines can't save lives unless people are vaccinated. So, I go out and I give Michelle a lot of information on what I see. So today in Save Mart at 7:30 this morning, which is Tuesday, so it's senior discount day, and it's also early in the morning, so a vulnerable population today, one employee had a mask on. However, 12 customers had a mask and 9 people did not. So I thought that was good, it's changing. And not one vendor in the store had a mask on. On Friday of last week, no employees at Safeway had a mask on. Today, actually, they had 15 and only 7 did not. So I was pretty impressed with that. But in the customers in Safeway, only 5 people had a mask and 15 did not. And I won't even go into the largest gathering place in Tuolumne County because their numbers are outrageous. Thank you.
Thank you. Any other public comment? Anyone on the phones from the room like to speak? Okay, I'll bring it back to the board. I just kind of wanted to start out real quick. Okay, so we can't pretend things are normal when they're clearly not normal. All of the data that we've been collecting just in the past 2 weeks is showing a clear trend toward more infections. More infections will lead to more hospitalizations, and more hospitalizations will lead to more deaths. Already 73 of our neighbors and our friends within this community have died as a result of COVID-19. If this was an intersection down on Mona Way that had 73 people die within 16 months, people would be screaming for the county to do something about it, to change that intersection and make it more safe. And so I don't see any difference from the situation that we're facing with COVID-19 and some other clearly dangerous element that's existing in our community. And it's our responsibility to be leaders and to take a strong position on protecting the safety of our residents. And what we're talking about, if we look at what the state is doing with state employees, this is not for citizens. It's for people that are employees of an organization, whether it's the state or some of these other counties or some of these other cities, the people that choose to work there. No one is holding them down and sticking a needle in their arm. We're giving them options. They can get vaccinated. They can take that step to protect themselves and protect their community, or they can wear a mask and get tested regularly. Nobody's being forced to take a vaccine. So that has to be understood at the outset, that you have options, that it's not, nobody's being held down and getting a shot. Just like if you're in law enforcement, you have to have training to carry a gun and a badge. If you're an attorney, you have to have training for that. There are requirements that you have to meet to be an employee in these various professions. This is no different than that. And again, we have to be leaders in this. And I think just waiting and saying, pretty please do the right thing, it's clearly not working. Because if you look what's happening in Tuolumne County, we're trending up above every county in our region. And then Dr. Serdinki, you mentioned Fresno and Stanislaus County. One thing that I've noticed is that what happens in the valley, the larger, more populated valley counties, tends to happen in Tuolumne County about 3 to 5 weeks later. And so if we're seeing these huge numbers in these valley counties, it stands to reason that we'll be seeing that here in short order. And so the more time we take in making a decision about this, the more we're putting our citizens at risk. And so I would like to know from this board if this is something that we are interested in doing. The state is taking this tactic. Many of the other counties that we mentioned and cities are looking at having stricter employee guidelines for this. There is a path to do this, and it's entirely legal to do this as an employer. We need to look at whether or not this is a step we need to take. So I'll open up.
I agree. Our first duty is to make sure that the public is safe. I do agree that it's legal. It is well backed. I think the case was Jacobson v. Martin or Martinson. That in the case to be able to protect the public, we do have I think a duty to be able to step in. But as Supervisor Campbell mentioned, this is not talking about mandatory vaccinations to the community. It's not anything like that. This is offering an option to protect Tuolumne County employees and the folks that they interact with. When somebody comes into our offices, they need to know that we're doing everything we can to keep them safe. Whether that is the person getting a vaccination or whether that's a person getting, I think, a regular test. I don't think that's an unreasonable option. I think that's actually being really trying to find a middle ground that matches everybody's beliefs there. So I do think we should be in line with the state on this particular issue. I think it's reasonable. I think it's us trying to take into account, like you said, things are not normal right now. We are having a huge spike. It is very dangerous. We wouldn't be doing our job if we just said, well, we're not going to do anything, to each their own, everybody can just deal with it. That's not responsible, and that's not leadership.
All right. I recognize I'm in the minority here. And when this does come back to the board for action, I will bring studies. There's a lot of stuff that has not been talked about in this room, and a lot of information that you cannot find on Google, but you can find from reliable sources. We have not talked about the VAERS report. That's those who have been harmed by vaccinations or who have died. And right now, I think that number, they're 6 months behind, by the way, it's getting close to 12,000 people who have been killed verifiably by the vaccination, and hundreds of thousands maimed. I am in the minority because I do not think that our government should legislate whether somebody gets a vaccination or not. It's your body, your choice. I have heard people talk about how we have legislated for seatbelts and helmets for motorcyclists. Yes, and those things you can put on and take off. Once you have the vaccination in your body, you cannot take it off. You cannot wipe out the immunity that you used to have, and now you have an immunity that is for one thing. Anyway, I'm not going to go off the rails on this. You can tell by my voice, it's a very hot topic for me. I feel it's the wrong direction. Yes, the state is doing it. We don't have to do it. And there are other ways that we can manage this pandemic. So I will bring back studies to report back to you to try to explain the other side of the equation that we have not been hearing about. Thank you.
Thank you. Goldenberger. Kirk.
Yeah.
Okay.
So, obviously, serious situation, very complicated. Dr. Surjenko made a comment about being able to maintain our mission for the county. We do need to provide a workforce to be able to continue continuity of operations. We had some discussion, County Council weighed in as far as what we could require or not of our employees. We're not, as Supervisor Campbell said, holding somebody down and sticking a needle in their arm, but we are saying that they need to either get vaccinated or be subject to some restrictions and do testing, because we need to figure out what's going on here. We need to encourage our citizens, as I stated earlier, to get vaccinated, to help spread, but we need to provide the education. And I think we've done a pretty good job of that, but maybe we need to find and look for some additional ways to put information out there. But more than anything else, we need to ask for their cooperation and appeal to them, to prevent what Supervisor Brandon spoke to. We could be headed for another economic disaster in the county if we're not careful. And throughout the state, we could have things that, come back and get imposed that nobody wants. And if we don't do anything about it, that's the direction we're going to head in. And then at that point, there's going to be a public, uproar as to why didn't you do something, and what are you doing to help us? Well, my question is what are you doing to help the county now? So I feel that we should do this with our employees. Thank you.
Anaya?
Yeah, I
Supervisor
think
Kirk.
you guys know where I am on. Sorry, can you guys hear me now?
Yeah, we can hear you.
All right. I think you guys know where I sit on this. Obviously, I had some pushback last November, which I presented to the board. We talk about trends, Supervisor Campbell, I know there's trends appear to be headed in the wrong direction, but, we're also missing trends that we missed last year and that we're going to go into again with public health, with mental health, people having mental health issues that we're not discussing. You know, I don't mean to be funny about this, but I read some studies where people stayed home from COVID and they became obese. So now they're at greater risks of cardiovascular issues. We're not mandating that fat people go get tested or that they get on diets. And I'm not trying to mix the two because it's two totally different, but I hate that we as a government and the government is singling out COVID and making it the issue where we all have to fall in line. I feel like we're headed down a Marxist socialist trend where we're losing individual liberties and it's all about the collective society. And, you know, Brandon talked about we need to be leadership. Well, what happens if the state in 3 or 4 months says we're no longer going to pay for these tests? And now county employees or state employees have to start paying for these $200 tests per week, because I've already heard conversations about that. What happens when the state follows suit with what some of the private companies are doing, where they say you cannot be employed with us unless you get the vaccination? What are we going to be part of that leadership? I don't think asking people right now to get tested or to wear a mask is too terribly big of an ask. What I'm concerned of is where we're going and where we're headed and where I'm hearing things. And so I'm looking into the future and I'm drawing the line right now saying, I'm not going to set the stage to violate people's personal decisions in the future. And I think this is a step down that direction. Kathleen brought up some good points about some data, some information. I'll do the same as well. But, you know, I did that last November and I got no love, no support. It was disheartening. So, and the other thing too, you know, we talk about leadership. The county and the staff are watching this right now and they're hearing how disappointed the three of you guys are with people who aren't vaccinated. How is our staff going to feel when we walk through the hallways or we go to meetings and we see people with masks on and that tells us that they're not vaccinated? Are we going to be discriminating against them? Are they going to feel like, you know, they're under a different light? And I don't want that workforce environment. I know all of our hearts are in the right place. I'm not questioning anybody's hearts. I know we want the best for our community, but this is going to be an issue for me that I'm looking into the future, and I think we're headed in the wrong direction, and I don't like where we're going. So I'm in full support of messaging. I think Carol said that we're failing at the messaging. I think you three should be part of a messaging team with public health and drive that message home the best way you see fit. I'm not here to undermine public health. I'm here to stand for people's rights, which I see are going to be infringed upon here pretty quick. So that's where I stand.
Yeah, Supervisor.
I'd like to make one additional point, and that's the discussions about schools. And something that I heard loud and clear from Supervisor Kirk in the past was looking at the mental health of our students, right? And if you know, we're trying to do everything we can possible to keep schools open and manage that, but if this thing keeps spinning out of control, then that's at risk. And not only does it affect these kids mentally, which is, you know, well documented, but the other thing is there's severe impacts to the parents. And I know that this has, you know, definitely been an issue for Supervisor Campbell in the past and many of our employees. You know, that if you have to stay home because schools are closed and care for your children, then you're being impacted on being able to do your job, and it's creating a lot more problems, you know, in the households. So I think that's something we need to consider as well. Thank you.
Yeah, and I wanted to make sure that this doesn't get blown out of perspective, because what we're talking about here is the 670 roughly employees of Tuolumne County, half of which are already vaccinated. And so what we're saying is if you choose to be in public service, you're required to show either a verification of vaccine or be tested and wear a mask. Supervisor Brandon said it very more eloquently than I could say, that this is not an unreasonable thing to ask, especially given the fact that we have a deadly disease in our community. We're not talking about infringing on people's rights. This is an employment issue. If you want to work in the public sector, you have to think about public safety. Just like if you're driving a vehicle that's owned by a public agency, you got to wear a seatbelt. You can't be drunk. You can't be talking on your phone. These are all rules that agencies like ours have in place to protect the community, and they apply to employees. This is just like that, and it's well within the right of any employer to ask these types of things. When you go to a restaurant, all kinds of rules for how waitresses and cook staff handle the food that they serve you, and that's to ensure that it's safe, that no one's going to get sick, and that it's for public safety. There's no difference here with that. It's a small. I understand that in practical sense, this is a small step, but I do recognize that this will be viewed by some as a major step. But I just want to keep things in context here. We're talking about one section of county employees, giving them options for helping keep the public safe from COVID-19. That's it. It's not infringing on people's rights. I mean, you can say that as much as you want, but that's not what this is at all. Okay, is there any other discussion on this? Okay, because we have the ability to give direction on this, and so if we're open to doing that, I'd like to start the ball rolling and have staff work with the different bargaining groups and work out some kind of an agreement on that. I did hear you chime in, Supervisor Kirk, and I think Supervisor Brandon, you had something to say.
Yeah. Supervisor Kirk, you can go first.
Just a quick question. Working for the state, I believe it's a HIPAA violation if I ask somebody if they have a vaccination for chickenpox or for any other disease. Can we verify if it's a HIPAA violation to disclose if people are vaccinated or not, or has there already been some court ruling?
County Council goes going to chime in.
Right, Supervisor Kirk. It's not a HIPAA violation to ask for proof of vaccination status. That's something that our County Council Association and all the employment law attorneys have been looking at since we knew vaccines were going to be obviously part of this COVID recovery. So it's been looked at thoroughly.
And then my last question would be, if an employee chooses not to disclose if they're vaccinated or not, is there going to be disciplinary action or repercussions?
I think part of this discussion should probably happen in the closed session bargaining, but what we would normally do is if they refuse to disclose, then you treat them as if they're unvaccinated, and so the requirements for unvaccinated, the masking, the testing, that would go into effect.
And I don't know why we talk about this behind closed doors. If they didn't wear a mask and they didn't disclose, would there then be disciplinary action?
Part of this is proper for bargaining because we know we have to meet and confer with the union. So once your board gives direction that you would like to implement a similar policy as to the state of California for its employees, then your labor negotiators need to meet with the unions, and that includes discussing disciplinary action.
Okay. I'll just put it out there. If any employee is facing disciplinary actions, come talk to me.
I don't think that's what's being proposed, certainly not on my side. I think if somebody chooses to not release their vaccination status, they would be just tested regularly, and that's the option they'd pursue, which is not a huge deal. There was one thing that was brought up thought about it, whether I wanted to respond. I feel it needs to be brought up. It's very dangerous to, I think, from a public office, state that vaccines are killing thousands of people and causing severe injuries. From the public health course I was taking, there's a lot of people, whether it's measles, whether it was smallpox, whether it's the anti-vaccination league. I think that is actually one of the reasons we're having a difficult time discussing this as a procedure, as a policy, is because some of that stuff has gotten so away from the purpose. The VAERS system is an early warning system. It's not a correlation system. It has nothing to do with whether the vaccine caused anything. It is self-reported data. It is basically stating that if anybody within a recent period of getting vaccinated dies, has an illness, and self-reports that, it tracks what happened, so that then our public health and epidemiologist officials can look into that and see if there's correlation. And there's been exceedingly few correlations shown between anything serious, except I think for the most rarest of rare circumstances, the blood clots. For the audience's benefit, I'm not here to try and pick a fight on that. I know that, and I respect that you believe very strongly on that, but I need to just voice opposition to that concept there, because I don't think that's how that data, it's what it means, how it's intended to be used. And I think saying that vaccines are, when going through these processes, generally anything but pretty safe is, it's not it's a unwise thing. Anyway.
So I'm going to bring things back to what we're talking about here. So I realize that this is, an emotional issue, that it has a lot of, it's divided our nation in a lot of ways, and it's happening right here in Little Tuolumne County as well. We're having some of these conversations that are playing out at every stage within our country. And I'm just coming at it from this perspective. I want to be able to say that if our infections are climbing, if people start becoming sick and dying, I want to be able to say at least I tried to do something. And we don't have a whole lot of tools available to us. But this is one of the tools, and I'm in favor of developing some kind of plan similar to what the state health officer is. And I think that we're have a majority to put direction in that way. So what would be the next steps from here?
So the next steps, as Sarah said, we will discuss this during closed session to fine tune some things that we can go then begin the process of meeting and conferring with our bargaining units. Once we have done that, then we will begin putting together the administrative process that would allow us to implement this for all county employees.
Okay.
The agenda does allow this board to provide direction today, so we would not need to bring that item back to the board since we have a majority saying that you would like staff to follow the same guidance as the state employees are following, which is supported by our health officer.
And actually, that's a question that I haven't asked yet. Do you support this as a plan of attack for our county?
As a public health measure, yes, it makes immense sense, though I do appreciate the board weighing in on it because I do think it's a policy decision, so your direction is critical here.
Okay. All right. So, we'll move on then. Thank you very much, everyone that weighed in on this, and we're going to find a way forward. So we really appreciate the help.
Thank you, Dr. Sojanko and team.
Okay, so let's take a break. So it's 10:59. Let's come back at 11:10. Sorry, now your mic's
Okay,
on. There you
thank
go.
Many of your employees are underpaid and overworked, and I think a pay raise for the county employees is in order. I also support an incentive pay for vaccination, which I believe President Biden came out with a recommendation. And then I'm very firm that those who were furloughed without a salary and lost at least a portion of their PERS contribution that they will never get back, and also had to pay the exorbitant prices of Cobra get reimbursed for the Cobra expense above and beyond. Thank you.
Thank you. Is there any other public comment? Okay. County Council, do we expect a report out on this? Okay. All right, so we'll go ahead and recess into closed session. We'll return at 1:30. Okay, welcome back, everybody, to the meeting of the Tuolumne County Board of Supervisors. It's August 3rd. And before we go into our 1:30 appointment, I do know that we do have one staff report that needs to be updated, so I'm going to look to the board if it's okay if we reopen staff reports once more, just real briefly, okay? So we'll go ahead and reopen staff reports, and Ms. Batista?
2 sentences, Debbie Batista, County Register of Voters. We just got confirmation about 2 hours ago from our printer. Ballots will be mailed Monday, August 9th, which is 1 week earlier than required. If you get your ballot, please read all the information and make your choices. And because I'm such a number person, there are 46 candidates to pick from to be the recall candidate if the recall is successful. Instead of close to 50, 46. Thank you.
Okay, thank you very much. Okay, so we'll go ahead and close staff reports once more. And then, so I'm going to look to our board clerk to read our 1 o'clock appointment, and then you're going to give us public participation information. Is that correct? Okay.
1:30 p.m. Discussion on the use of American Rescue Plan funds and an update to our public participation procedures. Today, our county website link is not working as expected, so please tune in at www.accesstuolumne.org and click Watch Live, or you can watch on Comcast Cable 8. Additionally, the Zoom webinar via your computer using the link in our agenda is working, and it is the closest to real-time viewing and listening. Again, these media are not available for public comment, so if you wish to comment over the phone, please call 209-533-6581 to queue for verbal public comment.
All right. Thank you very much. Now, Supervisor Kirk, you said you had one thing you wanted to say. Did you want to do that before the staff presentation or after?
Just real quick, so I don't forget. Thank you. Just real quick, I wanted to have something right at the last meeting. I know things got busy and it didn't happen, but for those of you who don't know, I wasn't here last week at the ARP meeting. I'll never apologize for taking time off. I did take my son backpacking, but I was extremely bummed that I couldn't make it to the meeting, so I have watched the ARP meeting twice. Took a lot of notes. I want everybody to know who is here, that I have heard all your concerns, and I just want you to know that before today's meeting. And then secondly, I'm just glad to be here today. We were in a car accident this weekend, which is why I zoomed in this morning. My wife is 33 weeks pregnant, and we thought things were gonna go sideways pretty quick. So just glad to be here. We're gonna have some rough discussions, but it reminded me how precious life is, and just got to be here today.
Yeah, and very sorry to hear about that, and hoping everybody is okay. And all right, so if fine folks in the administrator's office are ready, then we'll go ahead and let you give your presentation.
All right, good afternoon, Mr. Chair, members of the board. I'm Jason Terry from your County Administrator's Office. I'm joined by Liz Peterson, Eric Earhart, and Tracy Riggs. And today we're kicking off the second discussion of the American Rescue Plan. This presentation will be relatively brief. It's meant to kind of kickstart back to where we were a little over a week and a half ago, and just remind us of some of the points and really get this discussion going on the best utilization for these funds. So we'll start this presentation, as we do with many, with our mission statement. That is, we commit to providing exceptional public service that creates a healthy and safe community, exercises natural, cultural, and financial resource stewardship, promotes economic prosperity, and enhances quality of life. Some quick points from our July 22nd meeting. The county has received approximately $5.3 million. We already have received that in hand. And we anticipate that we're going to receive our second installment of the same amount in late fiscal year 21-22. A reminder that your board does not have to elect to immediately allocate all of these funds. And in fact, any unused funds can generate interest. And then funds must be obligated by December 31st of 2024 and ultimately spent by 2026. You'll recall we went over 4 different pillars last week of what these funds can be spent on, including COVID recovery response, premium pay for essential workers, lost revenue for governmental services, and infrastructure such as infrastructure of broadband, sewer, and water. Of these, the most flexible is the lost revenue, of which we discussed the calculation a little bit, and our ultimate determination is that the entire allocation of 10.5, a little more, can be considered lost revenue in this discussion. Another reminder that the funding can't be used to pay down pension liability funds or internal and external debt, or to use it for such things as contingencies, reserves, or rainy day funds. All right, the next 2 slides go over your board's 2021 goals and objectives that were set earlier this year. Just a good spot to just go through them real quick and remind us of where we've been. So the first one listed there is to prevent loss of life and reduce property damage due to catastrophic fire by creating a strategic plan for wildfire preparations. So there's a few objectives there, going from fuels management on public-private lands, securing sustainable funding, and fostering community participation and engagement in fire prevention, and of course the education measures there. The second board goal was community and family health. And of course the first objective there being the negative impacts of COVID-19. And the second to address emergency needs in homeless communities and collaborate with our partners to combat homelessness. And the third board goal, implement economic planning and development efforts to meet current and future community needs. So this is developing policy and coordinating activities to improve broadband. This is align zoning with the general plan to streamline housing and commercial development opportunities, as well as exploring creative land use and zoning options to provide greater flexibility. The fourth goal is to modernize government and increase effectiveness to better serve the community. One of these tools was to utilize OpenGov to improve our transparency and streamline some of our processes, improve the website functionality and usability to enhance user experience, recognize the value of employee development, encourage professional growth so that we may better serve our community, and update internal policies to ensure objectivity and consistency in personnel and business continuity. And then the fifth board goal is roads and infrastructure. So it's advocating and securing funding for our roads and infrastructure, road repairs with emphasis on ditching, roadside brushing, and hot patching, implementing a road repair and construction strategy, as well as updating CIP to better manage deferred maintenance requirements and develop employee recruitment and retention strategy to once again better serve the community and meet board goals and objectives.
So now we want to take a little time just to highlight what we heard from your county departments as well as the public. And this is everything that we received as far as comments either at the meeting on July 22nd or before the meeting. I am aware that your board has received further comments since July 22nd, but just want to let you know that this is everything that we heard from the July 22nd meeting. So first I want to speak to the county department request. So we took all of the comments that we received and kind of listed them all up here. divided them by kind of general requests and then some capital requests. So just want to highlight, again, just for your board's recollection, some of the requests that were put forward. So there was requests for public safety wage increases. Fire had requests for vehicles and some other equipment. Animal control had a handful of equipment requests. Survey and GIS had a request for some additional equipment as well as software upgrades. OES requested a vehicle and emergency systems upgrades at the EOC. There was a request for a document management system countywide. Solid Waste requested funding for security around a transfer station in the Groveland Big Oak Flat area. Airports requested some shaded tie-downs and hangars. Ag requested a vehicle and some other equipment. IT requested a business continuity plan. And roads had a handful of projects that they wanted to see completed, some paving and overlay work. And then there was some crime reporting software that also came up from IT. As far as the capital requests from the county department heads, Health and Human Services Agency requested funding to help renovate the Tuolumne General Hospital. There was a request for some employee workspace improvements for ergonomics, to increase workers' comp claims, etc. Some water conservation improvements for county buildings. The community resilience centers, which we are funding through grants, are still in need of some furniture and potentially some AV equipment, so that's in there. There was also a request for a new generator here in this building. Also generator for the fire stations. I'll just skip over also generator for the probation building. As I mentioned, the EOC upgrades. The tax collector treasurer requested a sink in the break room downstairs on the second floor of this building. We talked about a space needs study for the remaining county buildings. The Columbia Pool, there was a request for some repairs there. There was a request for installing a walkway between the new courthouse and the new jail. And then the Armory building out at the airport, there was a request to do some maintenance work there so that we could potentially rent that out. And then this is what we heard from the public. And as I said, we went back and read every email that had been received and every public comment that was said at the board meeting on the 22nd. And here's what we heard. Increased pay for sheriff's office, increased staff and services at the library, general fire preparedness, and there were some specific projects in there, but generally fuels reduction, installing additional egress routes, and some messaging and enhancements around evacuations. There was requests for homelessness staff support, also just increased services for homeless, as well as some specific projects to support the homeless. There was a request for mental health education and outreach. There were also some road paving and overlay projects with some general requests for road paving projects and then some very specific ones as well. There was a request from a member of the public to add the furniture and AV equipment for the community resilience centers that are being built. There was a request from the public for no premium pay for anyone who could potentially be eligible. A member of the public requested emergency communication upgrades along Highway 120 and Highway 108. Also, a climate action plan implementation grant program. The climate action plan is something that the community development department is currently heading up, and so a member of the public suggested implementing a grant or establishing a grant to help implement that program here in the county, and then to increase youth recreation programs here in the county. And then some other projects that the community requested. These are projects that are kind of outside the scope of county government, but nevertheless within Tuolumne County. So there was a request for the Tuolumne County Arts Program, some funding for their programs. One Pilot at a Time requested some funding to help clean up the county. There was some requests from some of our water partners and other members of the public for water infrastructure and dredging projects. There was requests for affordable housing, business and nonprofit grant or loan assistance, request for broadband infrastructure or other related projects to broadband, request for CERT funding or the Community Emergency Response Team, sorry. I used to know that. Funding. Also, a request for air filtration systems within public buildings, a request for construction loans, electric vehicle charging stations, an enhanced recycling program here in the county, general child care assistance here in the county, an incentive program for green businesses, and then the Tuolumne City Sanitary District requested a funding request as a result of their lost revenue. So those are all of the projects that we heard or requests that we heard to your board, just as a recap. Now I'll pass it over to Tracy.
Okay, so many of you have heard my recommendations as we approach how we will obligate, or really how your board will obligate this funding. And, I sit before you today, and I know we have Debbie Batista here, and we both agree and just caution that we approach this very carefully, not knowing what will happen in the future. And so doesn't need to be all spent now. We have 3 years, and with what's going on with the economy, we just don't know what might happen. And we don't know if we'll have another state-imposed shutdown, which could have an impact on our revenues and create further issues in the future. So on this, when I look at this and I'm looking at it from a county organization perspective, knowing that your board is really looking at a lot of the community issues and you've been having a lot of conversations with your constituents. But as I look at this, I'm looking at things where we would focus on projects that would take us to our more sustainable financial future. Meaning, can we get out of rented buildings if we continue with the space needs study and we finish that and we renovate some of these older buildings that we have? We could move out of some of these buildings and it could save close to $1 million if we were to move out of all of them on an annual basis. And strategically target projects now, as it's pretty much what I just said, that'll put us in a better position in the future. Modernize government and improve transparency and increase efficiency to better serve the public. An example of this is in your Community Development Department with CARES Act funding. They implemented a document management system. That system did cost $300,000. That included the time to do everything as well. But remember, you have decades worth of information that was scanned and filed and categorized that now can be picked up from an employee remotely and made available externally to those that we serve. And then prioritize actions that have more urgency or will take longer to implement. If there are some projects that, whether they're internal to the organization or external to the community, that we know may take some time for us to implement, then we would encourage you to think about those as we move forward as well. And of course, our goal when we look at these is always to look at priorities that will allow us to serve our community better. So again, what information can we put more outward facing? What can we do if we have to go back to our remote workplace where our individuals can access all of that information, whether they're forwarding it to an individual, like a permit maybe, or documents. If you're at home, if you can access that information, it just makes it that much quicker to be able to get people what they need. So on here, this is not an extensive list. These are things as I look at the organization. And so I'm just going to go through these, and then, of course, we have a few more slides, and then we'd like to hear your board's direction. And as we look at this, I do want to, and I could defer to Supervisor Campbell for a minute, because we do know outside of this, there's been a lot of comments about employee compensation. And so I do want to address why I don't have compensation listed in these slides. So Supervisor Campbell?
Yeah, why don't you go ahead and explain that, and I'll riff off you if I see that we need any more expounding on it.
Okay, so I'm going to read a statement that that was developed between our County Council, Human Resources Director, and myself, because there are requirements that we must follow when we're dealing with compensation and benefits for our employees. So we'll do the statement and then we can expand upon that if needed. So the law requires the county to address wages, hours of employment, and terms and conditions of employment via a bargaining process. The board has a designated team for labor negotiations, and they're actively engaged in negotiations with each bargaining unit. The board will address compensation and/or benefits through this process. Any action outside of this process would be an unfair labor practice and a violation of the law. Do you feel like we need to expand any more on that, or is everyone?
Yeah, well, I mean, it's what prompted that is, we've obviously had a big outpouring of support for the sheriff's office, and I think all of us here are very much supportive of law enforcement. And There is a process to bargaining negotiations, which we're engaged in right now with that group. And, we have to follow the rules on that as much as we might want to make promises and make people happy. We have to be responsible with the process and follow the law, because there are actual penalties if we don't do that. And so I don't know, I guess I kind of restated what you said in my own colloquial way.
Yeah, we just wanted everyone who's listening and here with us today to know that we are actively engaged in that process right now. And so while it might not seem it's being addressed, it is being addressed. And we want everyone to know that. That's the purpose of that. So this slide particularly is addressing a few issues. Most of them are internal with a recommendation. But the first one, as I've listened, is this conversation about what can we infuse back into the community. So when we did the CARES Act, there was about $1.75 million the board had allocated to go back to businesses for impacts related to COVID. Like, what did they have to actually implement, or things they had to purchase in order to comply with the guidelines put out by the California Department of Public Health. So one of those ideas that was thrown out was this RAD card program, where essentially it's almost you put in $500,000 and it generates $1 million in local business. And what we liked about this, is we all talked about this together, is that this actually puts money and business back into our local community, as we are asking people to think more about buying locally, not as much online. We could encourage that through this. This also, it could be increased. So if we see that it's really being utilized, you could always increase it to $1 million, which then would generate $2 million for our local businesses out there. And it has a long-reaching effect when we do those types of actions. The other one is your board did invest in code enforcement. You use part of this funding to front load code enforcement officers. But what they will need is they will need money to get out there and do some of those abatements that will need to be taken care of. We'll follow up on all the back end when we talk about fines and penalties or whatever there might be. But in the beginning, they need the funds to be able to go in there and do that cleanup. So recommendation is to start out with $250,000. That does not go into the budget, just so everyone knows. It's not an operating budget. What happens is that would go into a trust fund they have just for abatement for code enforcement, and we would pull it out on an as-needed basis and report back to the board.
And could you explain just really briefly what a code enforcement, what that division does, what a code enforcement officer does?
Yeah, so with code enforcement, and I think we probably hopefully have Quincy here who might be a little bit better, more eloquent at this, but we have, and as everyone knows, we have certain codes and regulations, whether they're state and or local, that everyone is supposed to abide by. So I'll give an example. If you have someone next door, maybe they don't use a garbage service, and that garbage is just piling up all over the place and it's causing other issues, that would be a violation, and therefore code enforcement would be called in. With this type of money, they could actually go in there and do the cleanup, and then we would work with that landowner to go back and recoup the cost for that cleanup. But we could do it immediately. So it could be any types of things. It can be grading violations. It could be a building code violation. So anything that has an ordinance or a state code is something that our department would go in there and begin doing that enforcement to make sure everyone's following those rules, and with the effort that we're trying to keep everyone safe.
Thank you.
We are currently doing a space needs study. Your board had allocated some funds previously. As we all know, the courts will be vacating the historic courthouse next to us and the courthouse in Washington Street. For some reason, that does not sound right. And then we have a few other buildings we're looking at too. And we started thinking about, not only did the board say, it'd be great to start having our public board meetings in that historic courthouse. How awesome would that be to have people coming into there and experiencing that in a whole different way? But then staff started thinking about ways we might be able to get out of rented buildings by using our own space. So what we'd like to do is expand that. So what we'd like to do right now, we only include the 4th floor, and I'm trying to think, IT was going to be district attorneys. They don't want to move. They want to stay where they are. And what we'd like to do is expand it to this entire building and all of the A&F building. So when I talked about a document management system earlier, I've been told that there's approximately 1,200 square feet of space being taken up by paper in that building. So think about that being used for office space rather than being used for paper space, and we might be able to stop paying rent in another building. So if we could increase that space needs study, we would include all of this building, which means now you would do auditor controller, treasurer tax collector, assessor, in addition to this floor, and we really look at a comprehensive approach to what is the best use of our existing buildings. We're estimating to add those additional, all of A and F, and then the first, second, and supposed to be and third floors of admin would be approximately $175,000. And then the capital improvement plan update is actually one of your Board of Supervisors goals. It's number 5.4, and it's in the ordinance for the county administrator to develop and maintain a capital improvement plan. The last plan was drafted in 2011. I did bring this up about 2 years ago, and at that time, the board didn't want to spend the money, but I do feel obligated, since it is in the ordinance, that I would keep something like this updated, that we would bring this to your attention. And again, we estimate about $250,000. When I say that, I want to make sure everyone understands this means a firm coming in that has licensed contractors, engineers, architects, plumbers, electricians, and they come out and they really start addressing and assessing each of our buildings. The other one is IT solutions, and we've kind of grouped a whole bunch of them together, and that is your Board of Supervisors goal number 4, which is to modernize government. So there's a GIS software upgrade that Liz mentioned earlier, a surveyor printer and scanner, document management system countywide. So as I mentioned, the Community Development Department spent $300,000 just for their department alone. And then cybersecurity, and your IT director had got up there. They've done a lot of work, but we have, some additional work that they would like to pursue. And as you can see, all of those could be as much as $1 million. And then the employee workplace improvements, and this is your goal again, number 4. We have staff working, and I know this happens everywhere, but I'd like for you, if you ever get a chance, to go through our surplus. And this is where we tell employees to go when they need to get a new desk. Some of that is 50, 60 years old. It's not created. It was never, that type of desk systems were not designed for the way people are working now. And what ends up happening is we end up with workers' compensation claims that really cost us way more than if we were to invest in those spaces now. The other thing it does is I've listened to employees as they've been speaking, is what came up over and over when I was in the back of the room listening to these different events was they just want the board to recognize that they're appreciated by ensuring that they have decent equipment, office chairs, and everything from computers to their desk to their chairs, just that's how they know they're valued, that you would provide them with a workstation that is a healthy place to work. And then in here is also the animal control shower and washer dryer. Your director spoke to you about that previously. This would be huge for them to have that shower out there when they need to come in after some really rough work. It would give them a place to clean up there. And then this was brought up by your treasurer tax collector, but I will tell you, this has come up for many, many years, is we don't have like a staff room for people on the second floor. And actually, I would even say the first, and probably, I don't know if they even have it on the third floor, a sink. So when they are making coffee or washing their dishes from lunch, they're going into the public restroom to do that. And so there's been a request for some time to figure out a way to put a sink on each of the floors that don't have one right now in order for the employees to have that available, not be going to the public restroom to get water for coffee or wash their dishes. And the reason you're seeing some of these costs a little bit higher too is for the sinks, we just don't know how much plumbing might have to be done to make that happen. And so the total of all of these could be as much as 2.6 or almost $2.7 million. So some considerations I would ask your board to consider as you make some decisions and provide the staff some direction on where you'd like to go with this is, as I said, Debbie and my focus, and it's not just ours, it's everyone's, it's yours as well, but to maintain fiscal sustainability as we move through this. If we make obligations long-term with this funding that we know will end and we will never get it again, it could put us in a bad place, and we've all been there when I'm coming in with recommendations. The only place for us to make reductions is in our workforce. That's because we provide services, and that is never a fun task. And the impacts on the families when we do that is terrible, and not to mention the organization. So again, that's in your budget policy. Use one-time funds for one-time things. Alignment with board goals and objectives, which we included earlier in the presentation. Keeping in mind, we've been talking about this morning with Dr. Sergenko and the rest of the public health staff, but we have this incredible rise in COVID-19 cases. We don't know what will happen. It's very uncertain, and we don't have the results of the space needs study. We know we have employee bargaining and other unknowns going on. If you don't obligate the funding, it doesn't go away. Debbie has put that funding in its own separate fund that cannot be used unless your board appropriates it. In the meantime, it does earn interest. And the other one is remembering that the funding expenditure period is December 24. So we have some time for you to make some decisions. And what we would urge you is that think about what is most important to you right now, and we have the time to work through these things in the future. And of course, today we're asking that you would provide clear direction on the development of a draft plan that we would bring back to you on August 13th at the special board meeting. Once you make the final direction on that day, then we would incorporate that into the adopted budget, which we'll have a hearing on September 21st. And of course, we are more than happy to answer any questions and come back with any type of research that you may need.
Okay. All right, so what I'm going to propose we do is we just ask if there are any questions, and then we have a fair number of people from the public here, give them some time to speak, and then we kind of can sort of wade through some of these more heavy topics. Does that work for everyone? Okay, any questions, Supervisor Brandon?
I just had one quick clarification. These were at the front. This is what I've been sharing to my Facebook page. It's my personal proposal of where I'd like to see some of these funds go. It is titled correctly online for me, but that didn't print the title. And so I just want to make sure everybody understood this is not the county document or the county proposal. This is just kind of my thoughts on where this should go. So, thank you.
Questions?
I do have questions, and I hope this doesn't suck up too much time. Let me pull this up real quick. Excuse me. Okay, so there are some things in here that let me just pose this question. And if there's department heads here who fall under fire, animal control, survey, GIS, road projects, HHSA with the renovation of TGH, and obviously the sheriff's office. I think that's going to be a different discussion though. Basically, the question I posed, when I watched this video several times and I heard all the requests and wants, and thank you for putting this in this presentation. I wish I would have known this was coming, because I spent hours making an Excel spreadsheet, trying to figure out what the requests were, what the costs were. This kind of does it. I really wish you would have called me. It's okay. So now I'm jumbling around because this is laid out much better. The question I have is, if we didn't have these ARP monies to deal with this, what would we be doing in the meantime? How would you, department heads, be budgeting for these projects? For instance, fire vehicles, equipment, animal control, the $54,000 request, survey, GIS. I kind of want to know before I make a decision, were you already planning to budget for these, whether it was this year or next year? Or are these just asks that we just can't seem to get a handle on, and they're just that emergent and we just have to spend ARP funding? Because some of these are legit. I think it's ridiculous that animal control doesn't have a laptop in their car and they can't take showers if they get skunked. Like, I think those are things that I would like to address, but were you planning on budgeting for that anyway? So I kind of want to hear, and I hope this, you can give me 10-second question or answers. If you heard that called up, I would like to know what the plan was if we didn't have ARP funding. That way I can cross things off the list if we were planning to address those, whether it's this fiscal year or next fiscal year. So if people want to come up and give short answers, I need to know how to prioritize these things.
Hello, Supervisor Kirk. Thank you for asking that question. In fiscal year 2021, we budgeted $200,000 for the TGH renovation, and we have done a really good job, pinching some pennies and putting a good dent in that transition. We transitioned 8 folks, and we're transitioning 16 more within 30 days. In fiscal year 21-22, we budgeted $400,000. We will continue to budget, but it'll take us years and years and years to get to the number that we need to fully move over. And in the meantime, we'll be paying close to $500,000 in lease.
And when you say transitioning, you're saying moving employees from the current campus that we're paying rent on to the TGH office that we don't pay rent on?
Yes,
Okay.
correct.
Hello, Kelly Schroeder, Animal Control Director. So I spoke with the sheriff before the meeting started, and he informed me that he's received a grant, and he's going to check on the conditions of the grant, but if it works, he's willing to help fund the animal control computers. So I'm very grateful for that. And for the shower, unfortunately, we just haven't had any extra in the budget to do anything extra. So we do have, well, there are ways to decontaminate. It's just not as pleasant, as a shower. So,
Like a hose out in the back?
yeah, a hose out in the back, let's be honest.
No, I want you to have a shower. I get exposed from chemicals where I work, and I need to be able to decontaminate. I just
Exactly.
want to know if you are able to, in your budget, plan for that, or if you're saying it's that bad where you just can't.
It's that bad, I'm not able to.
Okay.
Yeah. Thank you.
Chief Cashy and Chief Murphy couldn't be here today, so I'm obviously going to answer the question for fire. Obviously, those costs.
I kind of know the answer because it's all over
Okay.
the place, but
Yeah.
please.
So the equipment costs obviously are in addition to what is already operating costs, and they just don't have that in their budget to do. So that's what it is on fire. So.
And I'm sorry, I'll clarify. I know fire, our apparatus is off the hook, so I understand any help you guys can get.
Yep.
Is appreciated, so thank you for.
Hi there, Kim McFarland, Director of Public Works, and we definitely don't have our requests in our budget. So 1.2 million for roads, those are special road projects that we are looking for additional money. We wouldn't budget for those at all. For the airports, that is revenue generating, again, a big wish list item. We have no way to budget for that. It's a big capital outlay. The surveying GIS, big large format printer, again, not budgeted. But I will say for solid waste, we did have some funds set aside to do the safety improvements at Big Oak Flat. They just couldn't be done right away.
So the solid waste, the transfer station security, that one?
Right.
For 250,000? Okay. And then could you go back to the one you were just talking about right before that?
The large format printer.
I think it was Survey GIS.
Survey GIS for the large format printer, $24,000. We don't have that budgeted. That's a general fund division.
And no idea, probably no grants out there, okay.
Well, not that we know of, no.
Right, okay. Thank you.
Good afternoon, Roger Root, your IT Director. I think the only question you had was regarding the GIS upgrade. And the week before, 2 weeks ago, we were notified at a conference that Esri was going to end the life of the product that we're using today in the version we're on. So we're going to be forced to upgrade no matter what. They're also trying to force customers to move into a different type of licensing model. So that's part of this upgrade too. They have talked about that for several years, and we have moved some of our licensing into that model, but this is going to force us to do that. It's critical for us because it's not just Public Works. This GIS is used throughout the entire organization.
Public safety.
It's the dashboard that you're seeing every single day for COVID is built on the GIS platform. So
okay.
It is used by all of our departments. It's critical. It has to be upgraded. It wasn't budgeted. It's not.
They just found out you have to get it done.
Yeah, and they just told us. So
Okay.
that includes the cost of the licensing, the upgrade, and some professional services.
So if we didn't have ARP, what would you do?
I would be begging for money later. I'd come back, adopt it, and ask for the money because it's something that's going to have to get done. Or, come the end of the year, it just doesn't work.
So we're
anymore.
paying for it one way or another?
Or we don't use it anymore.
Okay.
How much was that?
I'm sorry, what was that?
60,000, I think?
No, the GIS upgrade is going to be between 30 and 35,000.
Okay. Thank you.
Good afternoon, Dan Hawks, Chief Probation Officer. I know you didn't ask for me specifically, but I just wanted to address
And feel free,
emergency
anybody,
generator.
any department head who I didn't cover, if you feel like you need to make your case, please do.
And I just wanted to reiterate the need. As COVID has hit, there has been a huge shift in California and throughout the United States in a move towards releasing people from incarceration. We have a lower incarceration rate than we've had in 20 years, is what I've been told. So we are dealing with with offenders being released 7 days a week, we have staff that do pretrial detention risk assessments 7 days a week. Our building is completely in the dark. The downstairs is underground and it's unsafe to work there. We have no backup emergency generation. We are always looking for grants. This year, we were awarded $200,000 in grants. A big portion of that will be used to make infrastructure improvements at the juvenile detention facility. Unfortunately, we did not locate any grants that allowed us to use that money to supply emergency generators, but it's desperately needed. And that's all I have to say. Thank you.
Thank you.
Afternoon, Chairman, Board. The question was, what would we do with our problem should we not have the ARP money? And it's exactly what I've spoken to all of you about. I would come to you with money out of my general fund to reduce ongoing costs to invest into our employees. That's my solution. That would have been my solution. Just as an update from, what was it, 2 Thursdays ago, I spoke to you and I told you just prior to that meeting, one of our supervisors had notified us that he was leaving. And I also told you at that time that 2 other individuals I had learned, or at least it was confided to me, that they would be leaving as well. Not those 2 individuals, but 2 other individuals have now given us notice that they have applied elsewhere. I have 2 other employees that have also applied elsewhere, but I do believe that I will lose 2 almost immediately. So, thank you.
Okay. I do have another question, if that's okay. This one was for Cole Prisabella. Are you here, Cole? Hey, buddy. One of the questions I had regarding ARP, and Cole, you sent me this data, and I don't mean to put you on the spot because I know we're moving quick. You know, one of my thoughts with ARP funding is the government shut a lot of businesses down or restricted them via the blueprint, and I definitely don't think the conversation is going to be hammered out today. I think it's going to be pretty long and have to do a little bit of research. But how do we as a county, and help me along here, but how do we capture those people who fell into that blueprint, the wedding venues, the hair salons, the bars, the restaurants, the people that we restricted? How do we understand what that amount is, how many people were involved?
Right.
I'm not trying to I don't want to make anybody whole. I just want to know, I want to get numbers so I can see if we can't, in good faith and goodwill, make some things right for people that we restricted and shut down.
Sure. So there's quite a disparity on between those businesses that were really affected by the coronavirus and those that weren't. You said a couple that were very impacted. So when you start going down the list of service industries like salons, restaurants, wedding industry, especially in our area, tourism related, they've incredibly felt the impact. You can talk about a business that does a lot of rentals for that wedding industry. And yes, she was fortunate enough to get an economic injury disaster loan. And remember, this is a loan. So she's not getting a grant that she doesn't have to pay back. This is money she's going to have to pay back to the federal government at some point with some sort of interest, 3.75%, 30 years. But she fortunately received $150,000. But when you're talking about $500,000 in revenue, which she would typically get, it's a drop in the bucket. So we do have a lot of businesses that are service-related, wedding industry related, that are definitely not whole and probably won't be whole from any sort of program that we can even implement with 10,000 or 10 million. So I think some of the list of the things that we've talked about as priorities, like a RAD or an economic disaster loan or some sort of revolving loan, those are things that will really go a long way to helping. And I did put together some information. I'd be happy to share it with the public too. Spreading them out towards industry can happen. I can bring that back to a future meeting. But essentially what happened is we can essentially infer that there was about $80 million in federal and state funding that did come to businesses that did take the time to apply. You had to apply. You just didn't get it from there. So
yeah, I know of some businesses that really hurt, and some businesses that couldn't believe how much money they were getting.
Correct.
In grants. And so you just brought up a good thing, which is loans. Is there any way we can find out people who had to take out loans to make it through the shutdown that we imposed?
Yes, I have all of the data. I was just talking to IT actually, that the data sheets are so large that they just crashed my Surface computer.
Oh.
So I have to figure out how to get the right laptop at the county building to actually go through an Excel spreadsheet with millions of data points that I can then separate the zip codes and find out the industry codes. And some of them even do have some business names. So yes, we truly could find out where those SBA economic injury disaster loans were and Paycheck Protection Program loans did go to,
Okay.
including the state as well.
If the board would and I don't know if we need to make that decision now, but if the board would entertain looking at people who took out loans and who maybe still be paying on those loans, I would like to know that information. For
It's
future
public,
discussion.
it's so I think I could present on it. It's public information that the SBA, the federal government, released for transparency. So
Okay.
that information, me telling you, is not proprietary or private. It is
Okay.
public information.
So I would like that for future.
Okay.
I don't know where, I think you kind of know where I'm going with it, but I need data, I need information to make an informed decision. Because what I don't want to do is, if I was the only one making a decision, I don't want to cut, a check for the businesses for $5,000 each when some people really got taken care of because of the industry or they were savvy or they're in the right place at the right time when these things came out versus people who are still suffering because of loans. And I just want to know what those numbers are so I can just.
Absolutely. So I can
Pay
come
us
back and
numbers.
give you some direct business names essentially and also give you some advice and guidance on what industries really felt it. And yeah,
Okay.
we could start making inferring some decisions and even reaching out to those businesses that
Okay.
did end up taking
So you kind of
loans.
get where I'm at.
Yep.
And if you could make that happen, if the board's okay with that, I'd really appreciate that.
Absolutely. And did you guys want me to pass out this data? Then I would have to pass it to Heather as well. Or I can save it for a future meeting.
Maybe, because I don't want to suck up all the time. I appreciate you doing that. Unless the board wants it, I think where the stuff I've requested, maybe you can include that with it, but
All right. Thank you.
appreciate it.
I'll bring back
Okay.
some information.
Okay. Yeah, let me see if I have any other questions. I know I do, but I don't want to take up all the time, so I will have comments later, but I think right now it's question time, so I'll pass it off to my fellow members.
Any questions, Supervisor Haff? Okay. So again, there's 3 years to spend this, correct? And so there's no need to allocate the money right away. But if we do allocate a portion of it now, what happens to the portion that's not allocated? Does it go into a bank? Does it generate its own interest? And can that interest be used by the county for other purposes? What's the prudent long-term strategy to stretching this money out as far as we possibly can?
So, and I see Debbie coming up, so she can explain how she does her accounts and stuff, but it's not in the general fund. It's not able to be spent unless your board appropriates it, but Deb can speak to where she placed it, how she's monitoring it, any interest it might accrue, and so forth.
Sure. Think of it that it's its own bank account. The treasurer invests all the money, so he doesn't know which bank or which fund has how much money, but I do. So it's in its own bank account, just like the general fund has its own bank account, health has its own bank account, et cetera, et cetera. So the $5.3 million is sitting there and has sat in there since May. There was no allocations, no budget allocations between May and June 30th. It earned $6,700, so you have $6,700 more to spend. And in this fiscal year, and I'm going to make up numbers, say you only want to allocate $2 million of the 5.3. So you would budget the $2 million. I would highly recommend that you budget the difference in contingency in case you want to do any projects during the rest of the year, but it just sits there and the money sits there. And then say somebody has a great project and they come to you in November. Then what you can do in November, it will take a 4/5 vote. You will move the $100,000 for this great project out of contingency into whatever that expense is, buying a generator or whatever it is. So you do not need to budget line items for the whole 5.3. You want to budget the whole 5.3 with the balancing number in contingency to give you the ability during the year to re-budget that money into a true project. Yeah, hopefully that makes sense. And you'll earn more interest every quarter. So you have $6,700 more to spend.
Okay. All right. Okay, if there's any other questions, what I'm going to propose is we take a brief 10-minute break and then come back here and then we'll do public comment. Does that work for everyone? Okay, so we'll be right back here at 2:32. This is the Tuolumne County Board of Supervisors. I'll look to our clerk to go over the public participation procedures for those of you that want to call in, and then we'll go ahead and start with the folks that have come down here to be with us today.
During the board meeting, citizens physically present who wish to provide public comment will be invited to do so by the board chair. Citizens who are not present and wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment.
Okay, so I'll go ahead we'll go ahead and open up to public comments. I'll invite, I'm sorry?
Just order of procedure. It's on, right? You can hear me?
Yeah.
Order of procedure, should we find out how many people want to speak and figure out how many minutes we want to give them before?
Okay. So if you're if you're in the room today and you'd like to speak on this issue, could you please raise your hand?
On which issue?
So on the 1 o'clock appointment. So any comments on this appointment? Could you please raise your hand? Sorry, I was.
Kind of vague. And
okay. Do you want to limit it to 2 minutes? Good with 3? Yeah. Well, we'll be having more people calling in later, so I think it might be a good idea to limit it to 2 minutes. I'm looking around. Do we agree on that? Okay. So we'll go ahead and put a 2-minute time limit on that based on the number of people. Okay. All right. Thank you. All right, sir.
You're set?
You're up.
Alrighty. My name's Terry Northcutt. I'm a lifetime member of this community, spoken before you on other occasions. I'd like to bring something forward that it bothers me that the sheriff comes before you with hat in hand and is pleading for crumbs. At the same time, what this man really needs is a full loaf of bread. He can't handle what he's got going on right now with a pittance of the funding that he needs. I would implore you to look at the different ways you can go about obligating funding for the Sheriff's Department. I would propose that you obligate, and understand you don't have to spend it yet, it's already been directed to you. All you have to do is obligate $1 million a year over 3 years to the Sheriff's Department so they can build up and try to sustain what we need to be protected and safe in this community. Things that keep coming up, and I mentioned this at the last meeting, generators, this type of thing. We've just had 3 400 kW whisper watt generators come across our desk, ranging in hours from 450 to 535 hours. They're $22,000 a piece. This is the type of thing that we can help you with if you go ahead and engage us on this. But please help fund the sheriff where he needs to be so he can do his job. The comment was made about the bargaining units. If you look at the way the funding came down, there's clear direction for your emergency responders, your EMS. There's not a single thing in there that says if it's approved by the bargaining unit. I believe the direction that this money came down to you will trump any of the pushback you get from the bargaining units that are saying, well, we didn't get it, or whatever the case may be. Please fund him what he needs and fund him more than what he needs so he can do his job and protect us. Thank you.
Thank you.
Supervisor Campbell, I'm sorry, Supervisor Half would like me to just address one comment that was just made, if that's acceptable.
Yes.
So the issue about how the limitations on the ARP funds, yes, they are for certain types of employees, but under the government code, the MMBA, the county has to bargain over certain types of compensation, et cetera. So I just want to make sure that everybody understands that we cannot in any way sort of go about that process differently. Thank you.
Thank you. Good afternoon. I'm Steve Campbell. I was here this morning as well. I'm a longtime resident, business owner, and now a very concerned citizen. We're not just approaching, in my opinion, a public safety crisis. We're actually in one. And to hear what the sheriff had to share again today, really it's getting very, very alarming. It's a shame that our sheriff can't even offer competitive wages to his deputies and perhaps staff. In this situation, he must be able to offer a competitive package, and especially wages, in order to turn the situation around. Crime is clearly on the rise, including violent crime. We need to have the ability to get the staff where it needs to be based on his professional recommendations. Instead, we're burning out the deputies that we have, and they are choosing to go elsewhere for better pay and support, probably reasonable shifts. I strongly urge you to support the sheriff's request for recruiting and retention of his deputies. I also, however, understand the need for sustainable financial viability, as our CAO mentioned. Maintain fiscal sustainability. I've heard that a lot, and I must say I've been here long enough to see the names and the faces on this board change an awful lot over the years. But what I find disturbing is this is a very familiar story, folks. Very familiar story. And I have to say, as a businessman and a resident and a taxpayer, and I've lived in 5 states, though my family came here in 1846, we have got to stop driving capital that is here out of the county, and we've got to be more aggressive and innovative in attracting new capital to the county. We cannot tax or cut our way out of this problem or to prosperity. You've got to face that. You have got to get on a war footing to get this underway.
Thank you.
Thank you very much.
Bruce Erickson agreed with that. None of us have to wear a bulletproof vest to work. We just don't do it. Think about what that would take if you were going to have to go into a domestic violence situation, et cetera. I got robbed about 15 years ago, and the sheriff's department did a great job. The guys went away for a year apiece, and the probation department is in lockstep with the sheriff's department because they get all the people that are taken in and given catch and release treatment. And right now we're coming out of the COVID thing, and Emil Durkheim, the German sociologist, referred to this time as sort of a time of anomie, normlessness, and it's very, very difficult to find your parameters. But one thing that Maslow talked about was the pyramid of needs that people have, and I think we need to take that as some kind of a benchmark because physiology was part of that in terms of food, air, water, et cetera. The next step up was safety. And one of the things I wanted to say about Dr. Shurjenko this morning that I think needs to land on you guys, especially in your budget and bargaining positions, because we need to not just cut positions or cut employees. We need to cut wages from some of the people that are working here that are making 100, close to 200 a year with an undergraduate degree with maybe 10 years experience. We can do better than that. And that's about 6 times as much as a deputy is going to make, trying to make $24 an hour, really? And he's going to not go on down the road? I don't think the sheriff would quit on us unless he didn't have the tools to do his job and it was too debilitating for him. If we don't give him the tools to do his job, people are going to be buying guns to protect themselves. It's going to get real ugly. And we got more and more crime all the time. Wait until you get robbed one time, and then the liberal becomes a conservative. A liberal is just a person who hasn't been robbed yet.
Thank you.
Good afternoon, Bruce Dudley, chairperson for Pine Mountain Lake Safety Committee. Retired from AT&T with 36 years. I'm also a CSU member for the Sheriff's Department. I also volunteer on the CERT team. One of the things that I hear most from the people is safety and security. What happens when I call 911? Do I get medical response? Do I get fire response? Do I get police response? Medical and fire are doing pretty good. The police for the Pine Mountain Lake side of the county is not very good at all. It takes 45 minutes minimum to drive from here to Pine Mountain Lake. If you pick up the phone and call 911, do you want to wait 45 minutes for somebody to show up at your place and give you a hand? One of the things I know we need to do is help get more volunteers. We need more volunteers for CERT. We need more volunteers at the library. We need more volunteers for the CSUs. So I think that's one of the things you as the district supervisors need to help motivate people. I don't know if it's through advertising, I don't know how, but the more we can get people to help, the more I do for the Sheriff's Department as a CSU volunteer helps put one more sheriff deputy on regular patrol. Thank you.
Thank you.
Good afternoon, Bob Esquith from Groveland. Basically what he said. And there was a recent call on the 120 corridor. That's the part of county that you four don't deal with. Kathleen has to deal with. It was, I believe, a hostage situation along the 120 corridor. And it was a 911 call for law enforcement. A lot of law enforcement arrived. The first law enforcement officer came from Yosemite National Park. And I believe, I won't speak for the sheriff, but I believe that Tuolumne County Sheriff was second, third, or fourth on scene. That's just not acceptable. I'm paying taxes to the county and I'm expecting somebody there. With the county having approved before, or just in the last year, more development up that way, I think we need to have another officer. And I think it needs to be assigned to South County, period, full-time. I recognize this funding is not permanent funding, but the need is permanent. And so what I would suggest to you is let's get it funded, get an officer down there, and in the next 3 to 4 years, there will be opportunities to get it funded. Second point I want to make is communications. When the mock fire happened and PG&E cut the power, comms went off in the Groveland area completely. Internet went down, landlines went down. The only thing that tended to work was most of the cell service. So we need to get some of that infrastructure for the internet operating there. And I know that the current bill in Congress funds infrastructure. So let's get some infrastructure funding in this bit, the monies that you have, and then be able to replenish them with the money that is coming out of Congress. Thank you.
Thank you.
My name is Darren Wardell. I'm a longtime resident of the county, over 20 years. Had a lot of experience in both private business and in government employment, and I've seen the consequences of not being able to have competitive salaries for employees. And the underfunded, the lower paying jurisdictions become the training ground. People just getting into an industry or a professional take the job, and as soon as they have enough experience, they move on, which creates a multi-layered problem for the sheriff, because they'll have, if they manage to recruit a few new employees, they'll move on as soon as they have enough experience to be attracted to a better paying jurisdiction. From what I've heard today, it really sounds like this is a matter of priorities. It would be great to have, fill in the blank, all these other things that are being proposed for this money, the IT and everything else. But if we can't have a safe, sustainable community with a reasonable response, including the specialty divisions in the sheriff's department, so that so that the drug problem is being addressed. A significant percentage of criminal activity has to do with people trying to support their drug problem. And unfortunately, these can become violent or dangerous situations. So we need to address this, allocate the money, set the priorities. It'd be nice to drive down the road without bouncing up and down and having issues on a bumpy road, but it's not going to change our lives or make us less willing to live here. But if we can't get the crime and the security under control, it will. So I hope that you'll look at your priorities and prioritize the public safety that is necessary. Thank you.
Good afternoon, and thank you for this opportunity. My name is Sean Price. I've been in the county a little over 30 years, District 2 out in Columbia. Grateful to find out and get connected with my Board of Supervisors. In 2007, we had 55 deputies in Tuolumne County. And in 2007, we had a total of 28,000 cases or incidences where a deputy was involved. 55 deputies, 28,000 incidences. 2019, the latest data that I could collect, we had 45 deputies, plus or minus, and it sounds like we're going to have fewer. And the incident rate, over 52,000. So we have significantly more demand for Tuolumne County Sheriff engagement and fewer deputies. Now, just about a year and a half ago, 2 years ago, we had a threatened suicide in my family. We called the sheriff. Sheriff deputy showed up and made such a difference and saved a life in my family. So we may think of bulletproof vests and SWAT training and Bearcats, but there are other services that our sheriff office renders that is so powerful. One other case, I got a call about 2 o'clock in the morning. A aged older woman, I was on her call list. She had fallen at night, not a light on, and when I rolled in to finally give her some help, guess who was already there? Tuolumne County Sheriff, a couple deputies. It was amazing to see how uplifting, how encouraging, how loving they can be. Grateful for this opportunity. Hope you'll fund our sheriff. Thanks.
Thank you very much. And Ms. Riggs, I don't want to put you on the spot, but do you have numbers on how many active deputies we do have?
Well, I don't know how many active deputies we have. What I could tell you, which is what I'm trying to look up right now, which we're both looking for, is how many the board has allocated, which is at about 43.
Great, thank you.
Good afternoon, Mark Ferreira, Fire Chief at Columbia Fire Protection District. And I share the sheriff's issues with not being able to have a sustainable funding source to pay my firefighters a livable wage. Many of you might have seen the article in the Union Democrat here in the last couple days. We are on a very limited staffing to the point that our engine is browned out. I operate on $87,000 a year. That's not my salary, that's my budget. I budget $60,000 a year towards salaries, leaving me $27,000 to run my fire district. I understand that it's not the county's responsibility to help out special districts. I just would ask that as you go forward with these, looking at how to allocate these funds, your board, previous boards have constantly put the #1 priority in this county as fire protection services. I urge that as you look at ways of dispersing this funding, that you please remember there are other agencies that run calls in this county other than Tuolumne County Fire Department. It is becoming harder and harder and harder to hire personnel. If you look across the board, I had personnel leave to go dig ditches for in the valley for irrigation in orchards because they could make more money. When I'm paying firefighters $500 a month at the fourth busiest engine in the state, we're operating on the second or third smallest budget inside the county. So I just ask that as you move forward, look at those response agencies that provided service to the citizens of Tuolumne County during the COVID crisis. Thank you.
Thank you. Hello.
Good afternoon. Jason Revord from One Pile at a Time. I've been in here past couple weeks, talked to all you guys. We've been across all of your districts. We've been picking up trash that is polluting our waterways. We've got one supervisor here that I've seen that has shown up, that cares enough about our community to pick up trash, to make sure that we have what we need, that has given me the advice of what I can do to help our community and get through to you guys. I mean, this is polluting our waterways. We've got to do something about it. If we don't do something about it, it all ends up down at your place. Do you want it? I don't want it down there. I'm watching this stuff. I'm watching the feces in the water. We've got to do something about it. I'm willing to do it, but I need funding as well. I've got the safety of my volunteers has become to the point now where I'm having to stop them, get them out of the way, and put other people that are more qualified to actually grab things. I mean, we're having rocks falling on people, that not hitting them, but they're falling down in these creekways. We've got 80 yards of trash sitting across behind the Dodge dealership. It's gonna have to come out with a helicopter. I don't have the funding for it. I need to do capital investments. We're doing everything we can to get grants. We've got 2 people on our committee that are actually going through the grant class during this month. So I'm asking for $50,000 for new trucks, new boom, new quads, that's so we can get into some of these areas that are non-accessible for actual vehicles. Sitting over down in Woods Creek, right behind the heating and air place. That whole mountainside, not on the Camp Hope, but down further behind the heating and air by TUD. There's 80 yards of trash sitting down in the creek there. Thank you.
Thank you.
Good afternoon, Dennis Spezak. I'd like a clarification on the pay raise that they claim that they're asking for has to be negotiated. I was under the impression that he was asking for positions, not a pay raise. Now, would that have to be negotiated? Positions? Because that's putting the priority of safety first. Just fully staff the sheriff's department. And that's what I'm not clear on.
So I think I could try to clarify a little bit. I think that there are open vacant positions already within the sheriff's office. And what the sheriff has shared is that he struggles to hire for those vacant positions with the level of compensation that the county pays for the deputies. And so as a means of attracting more people to apply for those positions, more qualified sheriff's deputies, I think the focus is on the pay rate and benefits and that.
So you need to put your priorities straight too, in order to have the public safety taken care of. That should be number one in this county. Everybody's come up here has talked about it. We're losing people. We're losing good deputies. I've worked with a lot of them. And it's sad because they're just going across the river, down the valley, and that's it, and they're gone. But we need to look at that, what our priorities are. Every one of you were elected to make change. This is the time to make the change. We're tired of what was the last 30 years that's been going on. I've been up here 35. This has been a problem since I've been up here. Underfunded sheriff department. So please, think about it. It's for all of us.
Thank you. I'll do you a little longer because I answered your question. Thank you.
Hi, my name is Benjamin Anderson. I'm from
I live on Launchway, and I have a soft spot for the sheriff's department. I always have. Yeah, I guess that comes back from the Andy Griffith show. But I believe that the sheriff department is very much, we need a sheriff's department. I moved up here 20 years ago, and I remember you driving around, there were sheriff's departments, there were sheriff's cars everywhere. Not everywhere, but there are quite a few. You drive around, they would always, you wave to them, they wave back. They're always real friendly. I've had the opportunity where I've had to have two occurrences where I've had the sheriff's department have to come over to my home. One wasn't, well, neither of them were very good, but they were always very polite, very friendly, very personable. And now I see we're in trouble all of a sudden. Well, what happened? Why are we in such a bad situation? How did you allow this to happen? It should never have happened. We should never be in this situation. We are a beautiful country, a beautiful county, and we need protection. My brother-in-law had a truck ripped off. He's had water ripped off. And what do they say? They say, well, shoot, it's not $10,000. So there's nothing we can really do. Fortunately, he was able to get his truck back. But this is ridiculous. This is not Tuolumne County. This is not the Tuolumne County I moved into. We need to make this a better place to live. Otherwise, people will not come and visit, and it will just turn into a mess. That's all I have to say about that. Thank you very much.
Thank you. Hello.
Hi, Jay Canavan. I own a business out in Standard, and I echo a lot of the sentiments that folks have brought today in terms of prioritizing public safety. I wanted to add that we have several vehicles that we have for the operation of our business, and a couple of years ago, we noticed that in the mornings, we'd oftentimes have to put gas in those vehicles, and realized after, this became a trend that people were stealing gas at night out of our vehicles. And it's such a petty crime, but it's I think that it's just indicative of a larger trend that's been happening over the past 2 or 3 years. And we really need the sheriff's deputies out there looking out for our property and our livelihood and our lives. And as businesses come out of this pandemic, we just can't afford to have folks walking off with the resources that we need to run our businesses and have a successful year coming out of the pandemic. So that's what I wanted to add. Thanks.
Thank you. Okay, is there anyone from the room that would like to speak? Otherwise, we'll go, okay. Go ahead and come on down.
I'm Jonathan Foley. I have lived here in Tuolumne County for 42 years, born and raised. I have 2 high school boys, and I run with the board on Tuolumne County Youth Soccer, and we've had probably a 30% reduction in signups. So we're seeing a trend of families not being present in our community, and I know that that plays a big part in employment for all of these issues that we're dealing with. I know businesses, along with the Sheriff's Department, are struggling there. And so thinking about what families do value, I think law enforcement is one of those, a safe place to raise your kids. And so just a little perspective there. I definitely am for, boosting our Sheriff's Department in creative ways, in important ways, and hopefully, productive ways. Thanks.
Thank you.
Well, I
want to congratulate Sheriff Pooley on how to really get the crowd motivated here. So the budget discussion for the Sheriff's Department is tomorrow at 9 a.m., I believe. And this is unanticipated revenue, which should not be spent on ongoing operational expenses. So anyway, Bill Pooley, I love you, but I'm not going to support you on this. So I think we really need to look at where our problems are coming from and not just hiring more deputies and throwing people away into, incarceration. So we need to be looking at some sort of transformative justice and strategies on how to prevent and intervene and hold people accountable and heal them from violence and harm. So I don't know exactly how to do that, but perhaps with this funding, we could consider that. And for coal, I think we need to have some sort of business strategy to improve customer service in Tuolumne County. My big issue is public safety for pedestrians. So I think it was Modesto got some grant money for reflective vests. So perhaps we could look at getting some reflective vests with some grant money to protect us as we're out walking. I'm surprised that no businesses are here because this is for COVID economic recovery. And I'm really disappointed that the meetings have been hijacked on behalf of the sheriff, and no one is here talking about economic recovery. And then you've all heard from me in the back room. So some things don't cost money. So I think every business in Tuolumne County who was open during the pandemic, and the 5 of you, should make an effort to thank every employee who came to work during the pandemic. And not some tacky little note saying thank you, but look them in the eye and thank you, while standing 6 feet away. And I also would ask people, am I done now? I am. Thank you.
Thank you.
Hi, my name is Charlene Anderson. I've lived here since 1980, and I was just listening, and I was blown away by hearing what's going on with our sheriff's department. I work in rural areas taking care of elderly people, and we count on the sheriff's department, we count on the fire department to come out if we have any kind of issues. And it scares me to death to think that I make more than the sheriff's department and that they can't even cover the areas that have no police coverage. I didn't even realize how scary that was until I read what was going on. We need police. As a woman working out in the middle of nowhere taking care of some of these people, it's very scary. And 911, we need that. We need to be able to count on having a sheriff come out and help us. And it's not about coming out and talking to us. It's about I need somebody now, probably somebody stronger than me that's going to be able to help me with that. So I just want to say that I really think we need police.
Thank you. So is there anyone else from the room that would like?
It's up to your board.
I'm not understanding the question. So I'm only going to allow each person to have one bite at the apple in terms of comment, so.
Well, I'm just asking for clarification from council, because when I made the statement about the bargaining units, you were saying you have to go through the bargaining units. I understand that. What the statement was, the funding that's coming out was dedicated funding for emergency response. That doesn't mean you don't go through your bargaining system. What I'm saying is that just because you entertain a raise for the sheriffs does not mean you have to raise Board of Supervisors and other. Is that a correct statement?
Okay.
Is that, okay. Thank you. That's all I want.
Okay. Is there anyone on the phones waiting to speak? Okay, well, let's give them an opportunity.
Hi, this is Randy Ray. Live in Duane Hart. Been up here almost 60 years. We got an issue with our road department. Lack of funds, safety, driving down the road up North Tuolumne Road. It's horrible. That dip down there by Ponderosa, somebody's going to fly off that, through the guardrail and down the canyon. Somebody's going to get sued. That's you guys. You got Middle Camp, horrible. It hasn't been worked on in absolute years. That's a safety issue. You got Q Mill going up to, what do you want to call it? Cedar Ridge. That's a paradise ready to happen. It needs a emergency lane, that road widened, and so there'd be 2 lanes coming out of that area, and then 1 lane going up for emergency vehicles. There's major issues. I spent over $3,000 on steering and another $1,200 in tires. Since November, my tires are already half worn out. That's November. And the reason why is roads are bouncy. You lose traction when you're going up the road, especially uphill. It's every time your tires are bouncing, you're eating rubber. And look it up, all of those. Our road department really needs to work on our culverts. They're collapsed from the big cranes.
Randy, I got to stop you there.
Anyway.
Thank you very much. I had to stop you there. Apologies.
No problem. I'll say bye.
Have a good afternoon. Okay, is there anyone else on the phone that would like to speak? All right, so we'll bring it back to the board. Do you want to kick us off, Supervisor Kirk?
Sure you want me to kick us off? No. Okay. I have so many thoughts. I don't know where to start, so I'll just start. So forgive me if I bounce around a little bit. You know, you think you're organized, and then you start taking notes. Okay. I'm not going to go through this in any particular order other than I'm going to start blabbing out thoughts and ideas and what I'm hearing and how I feel in my heart. So first thing, I look at this as a critical position conversation. I've said it and I'll say it again. When we're talking about the sheriff's office, when crap hits the fan, they're the only office that's going to respond. I understand there'll be support staff behind them. I understand that, but I just want to make it really clear when people try and throw themselves into that sentence, we know who's going to show up when you call 911. So let's just be clear on that. The way I see it, I think, oh man, I have so many things to say. I watched the ARP meeting from last week, and there's so many good things said. I don't want to go through it all because I'll be here for too long. One thing that I did really appreciate from our tax collector was the recommendation to move slow. I definitely think, especially with relapse and COVID and the way we're doing things again as a government, nationally and as a state, and talking locally, I'm a little worried about what we're going to go through again. And so I think there's some things up front that I want to fund and do and have some follow-up conversations about how we're going to make things sustainable. But I really do take that advice to heart, that we need to move slow. We need to drag this money out as long as we can because we don't know what's around the corner. I like where the CAO's office is in a sense of, it'd be great if we could get some of these rents, if we could get out some of these rents and save those monies. I think across the board, if we could do that, there's some sustainability in that conversation. And so I don't know if, I kind of see this in two batches. I see this critical need, things that we need to discuss funding now. And then I think I see the second batch conversation about maybe we could use some of these ARP funds to create sustainability, for instance, like those rents and whatnot. I heard, the comment about hijacking the meeting with all the support for the sheriff's office. And I just want to touch on that real quick. I want every department head in here to know, if you feel like maybe you didn't fight hard enough for your department, don't feel like that. This isn't about who's louder, who's stronger, who can get more support. I think if we were persuaded that easily, we wouldn't know how to analyze data and make informed decisions. I want the department heads to know that I think the sheriff did his job, in that we all understand the number one role in government is the safety and security of our people. And don't tell me to put on a mask if I make that statement. Don't tell me to go get vaccinated because I make that statement. What I'm saying is, if you call 911 and your life's in imminent threat, the sheriff's office is the one who's going to show up. Okay. So, and you might throw up if they don't show up. So, right? So I don't fault any department head who feels like maybe you failed in getting enough support here. I heard what you said, and I want you to know that. I think the sheriff has been dealing with a systemic issue for a long time, and he simply sees an opportunity to jumpstart a fix and a solution. And I think he sees these funds as an opportunity to just try and correct something that has been ongoing. I know that when I was running for office and I started looking into data, and I hate not knowing information. I feel like I'm a failure if I don't know the information. And when I started digging in and he started showing me the data, I couldn't even understand or comprehend how he was dealing with the issues he was dealing with. Where I work, if there's an incident, you got so much backup, it's not even funny. When we have deputies on the street who, if they get into a one-on-one with somebody up in Groveland, if they're in Groveland, we're talking about the potential for loss of life on the deputy side, because there is not a backup. There is not another person in that patrol car. And so when I came on this board, I thought, well, you know what? My gold star is, it'd be awesome when I leave office, whether it's in 4 years or 8 years, if we could get deputies up the 108 and 120 corridor. That was like my vision. And then you start getting in these budgets and you hear there's so many needs across so many departments. And then even if you could fix the need within the sheriff's department, you really can't fix it unless, like he said, that the ask is to fully fund and retain personnel. And I would even be, what's the word? Not gracious, I guess gracious. Heck, if I had the opportunity, I think the need would be in Groveland more than the 108 corridor right now, because it's such a far drive. I know we have some deputies that are in Tweenheart that can make it up there, but I'm just saying I think I'm fair in that assessment. So what I am getting at is, I looked at Supervisor Brandon's pitch. Thank you. I mean, this is awesome. You were kind of doing what I was doing, but you made it look much prettier than me, so thank you for doing that. The monies that you're recommending, we can't, I don't know if we can get into how much we want to set aside, but I believe the money that you're recommending is half of what the sheriff was requesting. And what I don't want to do is put a Band-Aid on the problem. I want to look 5, 10 years, 15 years down the road, and I want to affect change now. If we're going to do it, I want to do it all the way or nothing at all. And it's funny because, don't take this the wrong way, public, and any board member up here or board members up here, but last year, the prior board, there were some board members who discussed about cutting a lot of services and putting that money towards law enforcement. So don't think that this discussion hasn't been had before. But the response, and even I was, when you realize how big the need is, what's the point of half-assing it? Either we're going to do it or we're not going to do it. Let's not cut services and not really do it. So even I was against cutting some services, in the library and pool, because really we weren't going to fix a problem. We were just going to put a Band-Aid on it. And so the board has discussed it, but it wasn't really meaningful. And then when we did have that discussion, the public completely did not want to close down any services. And it's a sucky position to be in when the funds that you have and that the funds that you can cut and the services you can cut, all those services touch people. It's the discretionary funds that hurt people and hurt the services. But this community had an opportunity to potentially go down that road and they completely chose not to. And I respect that. I think today, and what we've been hearing the last few weeks, is passion from the community. I think the sheriff has done a really good job bringing people up to speed on where his department at and where we're headed. And I also think there's been a complete shift in the mindset towards law enforcement where it really is just getting worse. And I think, I think law enforcement are going to be the new nurses. I think they're going to be sought after. I think they're going to be expensive. I think they're going to be well paid. And if we don't catch up, I believe, to that idea and that understanding, then we're going to continue to be far behind. Because nobody wants to be a cop. I grew up, I wanted to be an attorney, ended up going to school, and I got burnt out with school, so I didn't go to law school, but I liked being on the streets and doing things, and so I got into law enforcement. But I'm telling you right now, if I was in college right now, there's no way in hell you could get me to be a cop. No way. The bullshit that they have to put up with. I was just in a car accident this weekend. My wife's laying in a gurney getting ready to go to the hospital. My kids are screaming on the side of the road crying because they think, we're going to lose our baby. And this jerk pulls up beside us, and the cop cars are blocking him from getting out. And he starts cussing at the cops, telling them to get out of the way. The cops look at him like, hey, we're dealing with emergency. Can you just drive around? The guy starts giving him the middle finger, starts screaming at him. I drove home. I wanted to kill the guy. No, I'm not joking. I started yelling. The cops told me, hey, just go away. We got it. I wanted to punch the guy, but it just confirmed to me, like, just the crap that they have to put up with these days is completely unacceptable. And this isn't about ARP. This is about moving forward. We say we back law enforcement, but are we going to put our money where our mouth is? Are we going to figure out ways to jumpstart this problem and start addressing it? I don't know. I know I'm willing to. I know that there has to be follow-up. There has to be sustainability. Otherwise, if we go down this path, there will be cuts. Your pools will be closed. Your libraries will be closed. There will be things that will close. And I don't want that to happen. But if it has to, if you ask me right now, do you want somebody to respond when you call 911, or do you want your pools open? I'm telling you, it'll always end up on law enforcement because I get it. Okay? It's not because I work in law enforcement. It's because when my wife and I were held up at gunpoint when she was holding my daughter at 3 months old, it changes you. Okay, we're in Oakland. I'm just telling you, I have some life experiences that you just want cops around. Somebody said at the last board meeting that there's this perception, and if we lose the perception, I completely agree with that. It's the same thing inside the prison walls. If you don't have a perception of being strong, or you don't have a perception of an order, I'm telling you, you get walked over in a heartbeat. I learned that the hard way the first 3 months working in a prison. So, I think that we should prioritize these ARP funds. I don't have the numbers, but I think I can justify it with critical positions. If you fall into a critical position where you are there to save a life, then we should figure out a way to fund that position, and we should not half-ass it. We should do it all or nothing at all. And so I would like to work with the sheriff, and I'd like for him to immediately have conversations with us about how we can make this sustainable. And if that's the only thing that we do immediately and put everything else on hold, I'm fine with. If I had a big wish list, it would be sheriff, it would be some fire apparatus, and then it would also be the roads, because everybody wants roads, and then there would be some small miscellaneous things that don't add up to too much money, like some equipment, animal control, some small ancillary things that I think we could all afford. But I've been up here talking a long time. I'm sorry if I've been all over the place, but I kind of want to fix the problem or not do anything, and I need we need to be a safe community. I'm not being emotional about this. I know this problem has been around a long time. I'm just glad that that we may have an opportunity to maybe affect some change and jumpstart it. And so I'm all for taking that risk, and I'll leave it at that.
Supervisor Huff.
All right, the first thing I would like to say is that I appreciate every person who is here today and who has been here for these discussions, the public discussions with the board. I heard on the campaign trail that you wanted to participate more and you didn't feel like you could in the past, and I'm glad to see that you're taking us up on that. I'm not going to speak very much on what Supervisor Kirk just shared. I share some similar views. I am going to say that I'm willing to consider the use of some ARP funding for staff I got to get my glasses, for employee salaries. And the thing I want to talk about is the 5.3 million. I know we're going to be allocated for almost 10.6, but I'm talking about the dollars that we have in our treasury today, and I don't want to speak for that other 5.3 million that we haven't gotten yet. Okay, so in other areas besides staff salaries, I feel very strongly that we need to give back to the community, our business community, our mom and pop businesses, not the Lowe's of the world and the big mega corporations, but the ones, especially the ones who had to shutter and close. We need to do something for them. And one of the best things I have heard, and I don't know how many of you have heard about the RAD card. You've heard it mentioned today. It's down in the valley. It was actually started by somebody in Modesto. They had the great idea to start it. It requires very little overhead on our part, and I'm going to suggest $1 million so that it creates $2 million stimulus this year for our businesses. That means if you get a RAD card and you have $50 on it, you can buy something that's worth $100, but you're only spending $50. I think this is a good way to give back to any business who wants to sign up for this. There would be some critical aspects to it in the training so that any employee of a business who wanted to have this RAD card would need to have the proper training. The chambers and the Visitors Bureau have already said they would help with that. So I think this is a really good solution to give back to our business community that has been so stymied in this pandemic. And that would address goals. We have our board goals that we're supposed to be going by. That would address goals number 2 and number 3. I would like to also move forward in establishing a new fund and put $250,000 in it that would kickstart a new code enforcement program. We have heard today a couple of times from the One Pile at a Time people about how awful our situation is getting with the dumping. It's not just homeless, it's people in our own community that are dumping stuff. And we need to, in tandem with, hiring on these new code enforcement officers, instead of only having 1, we are going to have 3 once the other 2 get hired. We need to strengthen our ordinance codes so that they have teeth in them. In the past, some of our codes have been stripped away and they're meaningless. So we need to get a little bit stronger, not a little bit, a lot stronger in some areas of our code enforcement and then back it up. But we need to have some kind of a fund to start with this code enforcement. Coming down the pikes, it has not been totally developed yet. We need to have a hazardous vegetation ordinance code. We have nothing of the sort. And as you know, fires can start anywhere, but they're going to start where there's mass of timber and vegetation that will easily light. And we have lots of, let's say, owners of property, some improved, a lot unimproved, that don't manage that property, and we live next to them. And it's a firestorm waiting to happen. We need to have an ordinance code that has some teeth in it where we can send code officers out and take care of that. So I'm suggesting $250,000, and that would satisfy goal number 4. Because our number 1 goal is to prevent loss in life and reduce property damage, and because we have such an aging fire fleet, I would recommend spending another $1 million for another fire engine. Then the next thing would be, I know the Human Services Agency, Health and Human Services, wants to move, and I support that as quickly as possible, to move so that they avoid all of the, $500,000 a year in rental. It's ridiculous. And so to help move that along, what I would like to suggest is from this 5.3 million, a $1 million loan that would be paid back over time to help them in that initiative. And this would come back to the county slowly and then be reinvested in other needs. I also support the GIS software. I remember from the last presentation we got on that, it's due to expire and they will have nothing. And this supports all different county departments and the public. I want the public to know GIS software is used in the patrol cars, and it hopefully is going to be used to a greater extent in the future to support evacuation planning and exit route planning. We need this, and it's not a question of, well, we can save up for it. It's expiring. It's going to be a moot point. We'll have nothing at the end of this year, and $30,000 to $35,000 is a small price to pay for something like that, and it will help support our goals also of our number one goal. And then, I do want to say something about roads. We do need money for roads. So I don't know how many people here know about, there is a separate funding mechanism. It's $2 billion. It's not part of the ARP funding. We haven't heard much about it, but it's coming. It is for counties that are public lands counties all across the U.S. $2 billion. So we're going to get a portion of that. We're 77% public lands county. So I would suggest, even though we haven't gotten it yet, that whatever we get, and hopefully it's a lot, all goes towards the roads department, to reconstruct, maintenance, what if, the kinds of things that they've got on their wish list that they can only dream that they could, have money for. It won't be enough money to take care of all of the needs we have, because the roads have been an issue. The funding for the roads has been an issue for about 3 decades. And so it's going to take a long time to pull out of this, but I think we really need to dedicate some money towards roads, and I see this public funds counties money to be used for that. And finally, as most of you know, I'm a champion for broadband. We are going to be seeing more money than we've seen from the California legislature that just passed SB 156 for broadband. And we don't know how much match money we might need. So I suggest starting a fund for match money, a set aside for $250,000 if we need it for our broadband budget. Because some of that money, some of that $6 billion will be coming our way, and we need to plan for it. We're doing planning in other areas with our roadmap planning, and we'll be doing a strategic plan specifically for this county. So we need to plan money-wise also, which also helps with, communications and evacuations, law enforcement, what have you, and especially in the outer regions that don't have that now. All right, I think that's it.
Thank you very much. Supervisor Goldberg.
I too want to thank everybody for showing up today. Also appreciate that pretty much everybody is wearing the mask, with everything that's going on with COVID right now. I appreciate your being cognizant of that and your cooperation. As with Supervisor Kirk, we need to take the time to approach carefully how we're going to spend these months. Though they
They were designed in many ways, to fund things that would be appropriate in one-time spending. We do, the sheriff obviously has, serious deficiencies, right? And it's building up over time. I believe that some of these issues could have been taken care of over time had they worked on it. I don't always just go by the, you gotta fix everything at once, one big problem, right? It's like the elephant, right? You can eat the elephant one bite at a time. You can attack larger problems, over time as well. Unfortunately, we've gotten to the point where we don't have a lot of time here to, fix the issues that the sheriff has. The recruitment problem is critical. Retention is obviously a concern. As you heard the sheriff say just today, that he had a couple of more people that were leaving his department. And so that only compounds the problems. How we look at the funding is very important. I'm not against using some of the ARP funds to deal with the problems with the sheriff, but I am very concerned about the sustainability, right? Anytime you have a budget situation, and I know, here about a week ago, the sheriff got up and spoke and said that he was willing to gamble, on, funds coming in the future, and there's some potential for other funds that, could be sustaining funds. I'm concerned, by that type of line of thinking, because I believe that that's, quite honestly, what got the county in a lot of trouble financially, is because they just spent like crazy. They didn't have the long-term planning that, should take place. And so that's, I want to see where we're going to get funds. So things, when we're talking about other potential uses of the money, again, if we can, pay for the space at Tuolumne, the old Tuolumne General Hospital, and free up, moving the rest of public health and social services over there, that's a huge savings, $500,000 a year. And that's ongoing money. And that's what we need, is ongoing money. There's other areas that, were included in some of these charts. You look at something, like document management, and you go, wow, you could spend a lot of money on document management. But again, if it frees up, I think our CAO said, perhaps 1,200 foot of space is occupied by filing cabinets and paper. And if we've got a smaller department that we can get out of a lease and move into that space, these are investments, right? And they have paybacks, right? There's definitive payback times when we look at these types of things, and some of them might be as little as a year or two, some might be 4 or 5 years, but they're realistic and something that we need to look seriously at. We've also, quite honestly, we've got unknowns that we don't know where some things may come in the future. We talk about the upcoming projects that were approved but under appeal and within court battles right now, the Terra V project, the Under Canvas. Should those prove out to get resolved and they come to compromises, that could literally provide the county with approximately $1.5 million a year in TOT funds. But we don't have that yet, right? I wish, some of these discussions were a few months from now, because I think we'll know a lot more between now and the first of the year. But we don't. We don't have that information now, and we do have a problem, and we have to deal with it. And we can't keep putting off, the sheriff on these problems. The figuring out how to do this, again, we shouldn't be in a rush to spend these funds in a lot of areas. I think we need to approach it carefully. Some of the departments, they have real needs. Some are certainly more critical and time sensitive than others. But we do need to address these issues as part of the bargaining process. And we need to look at other potential alternatives where we could save, money in the county that would, have, produce some real outcome. Healthcare costs are going crazy up. Some of the plans that the county deals with, with the CalPERS health care, we don't have control over that. They raise the price on those costs, but, we can look at those things and decide, is there a better way that, we might be able to save money in other ways? There's just a lot of situations here, and it's never easy, right? This is complex, and it's simple to say we're just going to fix this right now, and I'm very emphatically, we need to fix the sheriff's department. The sheriff has, in some meetings that I've had with him, he's been articulated to me that he has some plans where he could do some reorganization and save some real money in his department. And if that plays out as he is, expecting that it will, and I sincerely hope that it does, then that's part of the equation, and I respect that he's doing that and looking for ways to help the whole overall situation. So, very reluctant to, call on any particular numbers, today, other than, I just want to express that I am firmly committed to law enforcement. Obviously, fire is a huge concern of mine with my background, and it should be a concern for everybody in the county, right? We've got historic, situations out there, the drought situation, the fuels, they're just so, incredibly volatile right now. And hopefully we'll get through this fire season without having major issues, but we've got all the potential in many areas of the county. So those things can't be ignored. We have to look at that, and the board priorities, very specifically are dealing with fire, but dealing with public safety as a whole is very important. So that's pretty much what I've got, at this point, but I just want to express my thoughts and views, on this so that everybody would know, where I'm coming from personally. Thank you.
Supervisor Brandon.
Echoing my colleagues, I wanted to say thank you. I know a lot of familiar faces been into these meetings over the past few weeks, sending us messages, emails. I think in leading up to this, we're talking about months of meeting with staff, members of the community organizations, a lot of conversations, seeing what other areas are doing as well, and probably hundreds, if not thousands of messages, conversations with people at all the different meetings. So I really appreciate that, because that's a really rich amount of feedback from the community to be able to draw from and determine the priorities. So it's funny. It's a weird amount. We don't get big Ed McMahon checks like this very often. We're able to say, for our priorities for the community, where do we actually want to put this and invest it? I won't take up too much time. I try to write out my thoughts here. That's the culmination of that feedback of what our community priorities are, how we can maximize the impact of these funds, both in short-term critical issues and in some long-term issues that we can be able to solve, and it doesn't solve everything. But I'm okay with solving a few problems at a time. I'll say that I hear on a lot of things, people coming up and saying this has been a problem for decades. Public safety is in that same area. I've been on this board 6 months. I certainly don't want people in 10 years saying that about this time. I think we finally have the opportunity to fix some of these issues. I think we have the obligation and need to be able to build that trust back. I did not run to tread water. Folks elected to communicate, to be able to prioritize these issues, think creatively, and to lead. So with that, in my outline, I believe we have some huge deficiencies in our public safety. Obviously, part of it's in the law enforcement budget, as well as in the strategic plan for our fire services, fire equipment, and how are we going to be able to fund that? I believe that's in line with our priorities, and so I've allocated in my estimate here 50% to public safety and put a number to it. The number that was told me that this is what is needed to solve the issue from the folks who know best about that. I believe that that's really important. That's talking about fire, sheriffs, the Emergency Operations Center and Animal Control. Somebody also spoke about CERT. I'm really happy about that because that's the volunteer response management. I got a little bit for them, but how do we get more community involvement? Second bit is for the community. This is recovery funds. We've had a really hard year. How are we supporting consumers? How are we supporting businesses? How are we supporting the community groups that are coming back after, like Interfaith, losing 80% of their volunteers? We lost a number of businesses, groups, habits. I don't want us to lose any more, and I want us to come back because community is, I think, the strongest thing we got going for us up here. So 30% for me, put to a number of targeted investments. You'll see I'm trying to work through, if we can, our chambers of commerce, motherload job training, other community organizations, One Pile as an example, that are doing this work, and how can we support their effort. Lastly, I think we do have some good ideas of how do we do some long-term investments the county needs. So I have 20% set aside for that. That does include some for the Tuolumne General office consolidation. It's putting some money aside on trying to implement our newly passed emergency shelter ordinance. It's investment in a few other things such as library, the GIS software, the scanner. I think that these are going to be something to pay dividends for quite a while and give us a little flexibility. I remain open to any messages. Please, you can message me on Facebook, send me an email. I'd love to get your input. Hopefully this is a clear enough direction on the priorities for me, for staff. And I will say that even though I know this is weird, I know we have normal processes for many of these issues. This is by all means an exceptional time in getting this type of funding and being able to address it. We also ask for public input, right? And I've been so impressed by the amount we received. We need to listen to that, right? That's the other side of it. We need to listen. We need to be able to find a way to make it work. So I believe we need to put a substantial amount of this aside for future bargaining to be able to address some of these issues as well. And I want to see a long-term solution out of this, whether it's from this funding, whether it's in another process, whatever the process is, that at the end of this, to vote yes on this, I need to see that issue solved. I do not want this to be something we see coming back here. And we need to support our sheriff's office. So thank you.
Thank you. Well, I'm going to take a different tactic here. I'm going to thank the sheriff directly for articulating the problem and in his department. And I'm communicating with the folks that have shown up here, and you have all expressed your personal experiences with the need for law enforcement, either experiences with law enforcement or those where you may have needed it and it wasn't there because of the staffing issues. So, and you know, I absolutely support law enforcement in our community, and I have for a long time, and I think we're all pretty aligned on that issue. I think it's easy to support our sheriff's deputies. They do a phenomenal job. They're kind of the backbone of any community like ours, where we're a rural community. But it's easy to say that you support law enforcement. I mean, they do a lot of good things, and there's a lot to like about them. But our job is to find out how to pay for these kind of services in the community, and that's a lot harder job. So I hope you allow us some grace in trying to work through the process of figuring out how to do that, because we absolutely do hear the community's voices in this, and that it is a need. And I wish I could end this on having one of those big, like, novelty sweepstakes checks and just hand it over to the sheriff and we'd be done. But there is a process when we talk about increasing benefits and increasing wages. But what I will say is that, you know, I am willing to consider using ARP money for staff salaries. And that's, you know, that's the important thing that we're talking about. I think that we do have a consensus on the board at that end. I noticed that one thing that I've observed kind of in hearing from you all and reading the emails is that this ARP fund it's kind of served as a bit of a lightning rod to channel some of the frustrations that we've had in the community over longstanding issues. Because, and I haven't quite figured out why it's that lightning rod, but what I think it is that it's a solution potentially for any one of a large number of systemic problems that we've experienced in our county. If we just spent all that money on this, then it would be fixed. And wouldn't that be wonderful? But there are so many problems in our community that also need attention. And so we're trying to find that balance where we solve or get close to solve. I'm never going to say we're solving problems. We're getting close to solving some problems and maybe helping others, and maybe others get completely forgotten and they continue to be problems in our community. And that's going to happen with this because it's $10 million. It's not $10 billion. $10 billion, I could make a whole lot of promises sitting right here, but so, and the other thing to consider is that counties across the state are having this exact same conversation that we're having right now with the community, with decision makers in their county governments, and they're all coming up with different solutions. And that's a good thing. It makes it difficult though, because there's not a lot of experience to draw on for how to spend these monies in a way that's most beneficial to your community. So we're shooting in the dark here. So we're trying to figure out how to best leverage these monies that's really going to help our community. And I really appreciate the feedback from the community because that helps us do our job. Because it's not our money, it's your money. And so we need to figure out how to best use your money to make our community succeed. My fellow supervisors have made some excellent points. Supervisor Kirk started out by saying move slow. I agree with that. I think there will be problems that will present themselves in 6 months, 12 months, 2 years that we're not even considering right now. That's how it's been for as long as I can remember. We've always been facing unique challenges in recent history. And you also said, if we didn't have this money, what would we do? And so that kind of helped me think, okay, yeah, that's a good point. We need to sort of prioritize things that were already identified as problems, that are already at some stage of finding a solution, and we can use this money to kind of push things across the finish line. One of the things that comes to the forefront of my mind is this space needs study that's going on right now. It's a problem we've always known about, and it's been something that I've tried to prioritize and push for and champion. Is we spend so much money on rental properties in Tuolumne County. And we've had a concerted effort, and our CAO, Tracy Riggs, deserves a lot of the credit for getting out of some of those lease agreements and getting people into publicly owned buildings, because you already own those buildings. You shouldn't be paying rent on other people's buildings if we already own office space. And we've been gradually doing that. It's been a very methodical, long-term, difficult process. And this offers us a chance to kind of skip the line. And if we're talking about, I'm trying to connect these things together. If we're talking about using some of this money that's one time for ongoing costs, such as the sheriff's office or any kind of staffing, we're going to need to find a way to pay for that. And the way we pay for that is by reducing costs in other areas. And so I think if we do kind of prioritize this TGH renovation and some of these other office renovations so that we can save money that is continual, then that's how you pay for these ongoing costs. And I think Supervisor Half, I was furiously writing down a lot of what you said because I think you made some really good points. I pretty much in agreement with you on a lot of these things. I think the code enforcement element, I really agree with you there. It's the thing, other than when this comes up. We've been getting more emails about the sheriff's office lately, but generally the most emails that we get are about trash and code enforcement issues. That's what people want their supervisors to get to work on and help them out with, is their neighborhood quality of life issues. And it's a real struggle and very disappointing for me when I have to tell people, we don't have any money for that, we don't have the staffing to help you, I can't help you. And so I don't like to have to say that. I like to help people. And so I think starting with $250,000 for code enforcement, I think is a good place to start. One thing, and so Supervisor Half, you mentioned having a loan program for TGH. Right now, I would tend to favor waiting for the space needs study to come back, because we don't really know how much the cost is for TGH. But that hadn't occurred to me doing a loan, so I would like to come back with, if staff can come back with if that's a possibility, if doing loans to ourselves with the ARPA fund, if that works, if that makes sense, if it's better to just pay outright. I think that's a good idea that's worth fleshing out. And then the other thing that you brought up that I think, it's funny, I think you and I have been kind of working on this independently, because I don't know that we've talked about it all that much, but I am also very interested in the RAD card program and have been trying to spread that word around and get people interested and excited about that, because more than anything, I think the ARPA funds need to be felt in the community. I don't want it to be something where it feels like it's going into things that, while they may be beneficial to the county as an organization, they're not really having clear impact in our community. And I think if we can pump $1 million plus another $1 million from local spending into our local economy, that's going to have real impacts. That's money that can go to local service providers, whether it's somebody that fixes your air conditioning or whether you shop at one of the shops downtown. It's not going to go to Amazon, so Jeff Bezos can build his rocket with someone else's money. It's for local businesses, local services, and that's what it's designed for, and I think it's a really great idea. I wish I had come up with it, actually. Supervisor Brandon, you brought up you had a list of different local organizations and amounts of that you thought would be appropriate to supporting those local organizations. I absolutely agree that some of this money should go to local organizations. I would structure it by saying maybe we set aside $500,000 and then have an application process, because I'd like to know what the different organizations are planning on spending the money on. I'd like to know more specifics about projects and what they're planning to do with them, how the money's going to be spent. And it's more of a fiscal responsibility thing than anything. I absolutely agree that the money should go to the people that are volunteering their time and effort. We need to support those people, because those are the people that make the county as wonderful as it is. So, and then the $1 million for the fire engine, I absolutely support that if we can't find that money in another way. And so I would prefer to wait on dedicating that until we know for sure that some of these other state, whether it's CCI or these other funds could potentially go for that. So I don't want to spend ARPA money on this when we might be able to get it from another fund potentially. So I would support that, but I'd be in favor of putting that off. And then I think the GIS software survey equipment, some of the issues that Roger Root brought up with IT, I think that's pretty much a no-brainer. It's a cost that we're going to have to incur eventually. It directly benefits the community, even though IT is not something that the community actually sees very regularly. It actually has an impact in every time you go on the county website, every time you pull permits, every time you communicate with anybody within the county organization, you're going through IT. And so if they're invisible, that means that they're doing a good job. So we want to keep them supported and doing a good job. And so that's kind of the specifics that I wanted to get into right now. I think that the CAO, the administrator's office, came back with a very good recommendation about being fiscally conservative a bit, being responsible, and making sure that we aren't going to decide right here, right now, how to spend the entirety of this money. I think it's going to be a bit of a process, and so please keep communicating with us. I'm kind of guessing that we'll get more ideas. I've heard different things out in the community than I've heard in this boardroom. I've heard more emphasis on roads and businesses and that type of thing, but that seems to be kind of changing within the past month or so. And so we need to kind of look at that and see how can we use these funds and make sure that we hit a lot of different areas, understanding that we're not going to solve all the county's problems right today. So that's kind of where I'm at. Are you making any sense of this, Ms. Riggs?
Well, we're definitely trying, and Eric has started a matrix, and we only have a majority of the board on 2 items. So we are supposed to be bringing back a plan to your board for the 13th for final approval, so we can incorporate it into the budget. So we will need more consensus from you on how you want us to do that. And I'll let Eric kind of talk you through, because since he's doing the matrix here, and then maybe we can get some direction. And then we as staff, meaning mostly myself, on any of those items that we listed were like increasing the number of departments for the space needs study, for example, or document management. We just need a yes or a no on some of those. But Eric will take you through, and that will, going through his process will help us with some of those.
All right, so as each of you spoke, I kind of took notes on what it was, and some of the things we heard was eliminating rent. There was talk about salaries, the RAD card, $250,000 for code enforcement, $1 million for a fire engine, the GIS software, $250,000 for broadband, document management software, improvements to the EOC, animal control, fire, the space needs study, and $500,000 for nonprofits through an application process. So what I kind of like to do is just touch on each one of these and figure out what that looks like to each of you. And again, we've only really had consensus on 2 of those items so far. So the first one is eliminating rent, and really what we're looking for is what does that look like to the board? Is that starting with a space needs study? Is that immediately putting money into our current facilities to retrofit them for moving folks in? So that would be the first one I would look for some clarification on.
I think we want to start with the space needs study and then find out what the costs would be after that's completed. Is that?
And on that note, though, don't we already have a space needs study for instance, the TGH? We just have outdated numbers?
No, so we've already started working on a space needs study, but what we're looking at is expanding that space needs study to include other facilities and other departments to ensure that we're maximizing the best use of our space overall in the county.
Specifically for rented places to come into.
Correct. So this building, the ANF, the 2 courthouses, TGH, the recreation library or recreation building that we have also by the courthouse as well, and including all of those facilities into that study.
Yeah, it's basically if we don't know if it's going to cost $2 million or $10 million to move into TGH, and so we don't want to commit to.
Okay, I just want to be clear. We're not talking.
Until we have the.
And I didn't say you said this, but we're not talking about Law and Justice Center. We're talking. Okay, thank you.
Correct.
So I think. Do we have consensus there? I think so.
Okay.
Sure.
Is it possible just to do set aside money for some of these things until we, like, for example, find out about this space needs study and what all that entails, so we don't spend it on something else if it's felt that that's important enough to set it aside?
So what we can do is we can try to, for each one of these, we can try to come up with a better number, more refined number before we come back on the 13th, hopefully, and share that with the board at the time.
So what we're in, to make sure, I'm sorry, I'm stuttering over my words because too many thoughts are going through at the same time. So what we need to make sure as staff is we are working on a space needs study. What we need to know from you, because we will have to work with the contractor, is do you want us to expand that space needs study, which is the amount I had in the slide, around $150,000 to $175,000, which would include this entire building, not just the 4th floor, all of ANF. So that's what we're looking for. We're not asking that you would put any money aside. Again, you can leave it there. We don't need it yet because we don't know. But we would need, if we really want to look at, are we using this space in the best way that we can to look at getting out of all the rented buildings if possible, then we would need to expand the current space needs study to include the rest of the buildings.
So just to chime in on that, we've got an existing effort going, and what I would be concerned about is that if we expand the footprint of the study, that it not delay the whole process, right? Because they've already been working on certain areas. So I would ask the contractor, even if we expand, to at the very least deliver us interim reports on the areas that they've got more hard data, so that we're not waiting until January to get this whole big thing back.
You will be waiting till January no matter what. That is the timeline, is January, that we'll be doing a presentation. So no matter what, we'll be coming January, February with the presentation. It will make a big difference. We've only met, I think I've only had one meeting. We've only had like a kickoff meeting, so there's not been a significant amount of work done. And the reason, I don't think it will delay, because they're meeting and they're taking us through each of those, but it will tell us if we're using all the space. I mean, maybe what we need to do is move, say, assessor and auditor into that building with the board and CAO and county council. We don't know. So that's what we're looking at, is right now, they're not included. So your auditor, controller, your treasurer, and your assessor are not included in the space needs study for this building. So, and HR is not included. So I don't expect that it will delay it. And you're right, what we could do is they're going to continue doing TG, so they could come forward with TGMF. Before we have final numbers, remember, we'll do space needs, but we will have to issue an RFP or a bid of sorts so that people can bid on the job in order to know what the actual cost will be. So even with the space needs study, we'll have an estimate, but we won't know until we put it out for bid.
Well, okay, so the good thing about the ARP funds, right, is that we don't have to make those decisions right away, right? We can hold back on our anticipated spending until we have more data. There's nothing that says that we've got to figure this all out by the 13th and then put it in, the adopted budget for September. We've got 3 years. I mean, not that we want to go anywhere near that far, but I mean, I just don't want to, be rushed into something without having the good information. I don't want things to be delayed.
Yeah, I just want to clarify, are you referring just to the space needs study? Because we'd have to have them come back and do it if you didn't do it now, which would probably be more expensive than adding it on while they're already here, just to make that clear. So that particular part, I do think it's more productive while they're here to add on the other department heads, rather than waiting. And we may even be forced to go out to another RFP process, which would further push that out if we completed this project and then tried to add on, which would not allow your board to really know what's the best use of, say, the historic courthouse with all of your departments in this building right now.
Yeah, so just to clarify, I'm okay with doing the increased space needs study, but I would be concerned that we not, your office not have to come back to us with, anticipated amounts for TGH, without having better data, to go with. I don't want to get locked into something there.
Absolutely.
Okay, thanks.
Okay, so space needs study is.
And one thing, just because somebody emailed me, somebody said that part of the reason why Tuolumne General was closed is because it wasn't earthquake proof. Can you just touch on that real quick?
It did not meet the seismic requirements for a hospital. That does not mean it can't be used for office
For a
space.
hospital, okay.
Yep.
All right, so what's the next one?
So the next one, obviously, as county council spoke about before, will be dealt with separately, which is the salaries
Gotcha.
for staff. So the ones below this are ones that we did not have consensus on. It was not that your board did not all support them. It's what's being supported today, because again, we have the time to spend this. So what we're looking for is, are there any of these other suggestions made that your board would want us to move forward on to bring back on the 13th and ultimately on the 21st? The first one would be the RAD card program. We heard mention of $1 million put towards that program. Is that something, I only had consensus for 2 at this point.
I think the RAD card is a good program. I would be hesitant to put it up to 1 million at the expense of something, say, like a revolving loan fund, or some type of other grant opportunity, as Supervisor Kirk mentioned, for businesses that were, hit the hardest during the pandemic. So for me, $1 million's a bit much for that, though I do have that in my recommendations. Plus, we do pay on that partly an 11% administration fee, which I think is pretty reasonable, but, it is something to think about as well.
So what would be,
I'll chime in on that. I'd like to maybe look at it a little bit lesser level, perhaps $500,000 to get into it. I think it's a viable program, and we can look at it, but I'd look for a reduced amount.
Yeah, sorry, when I gave my speech, I didn't go through all the line items. Yes, I support the RAD idea. I kind of, like I told Cole, I kind of want to know what businesses are out there who are still having to, dealing with loans so they wouldn't go under. So I kind of want that information kind of along with some of Jaren's discussion. So I support the RAD. I kind of want to get that piece of information from Cole, though. Maybe if it's not as bad as I think, maybe $1 million would be good, but for now, I can't put a number on RAD other than I need some more information.
Okay.
But I do support.
so we got two for $500,000 and then 2 for $1 million. What
And
do
then
you
could we
think? Could we meet in the middle here for
Well,
750?
I mean, so if
Challenge
if
from
there
you.
was only a few people who had loans and they were X amount of dollars, I'd be in full support of $1 million for RAD. But if there's a large group of people out there, and $500,000 could help a large. That's kind of what I'm getting at.
Yeah,
That's
one
kind
of the things we've also seen in other areas is they started with $500,000. They saw how fast the money was being pumped back into the local economy, and at that point increased it. So it could be something where we could start at the $500,000, see how things progressing, and come back to your board.
The challenge for me is what's it coming out of, right? In this, I have about 30.8% to a variety of fire apparatus, which I think is a significant amount of that problem that we're facing. That's 1.6 million. So if it's 500,000 from that, I would say no. If we're thinking that this is a better program than the revolving loan fund, I'd be open to the idea. As it is right now, there's a little over, at least in the way that I put it out, about 1.1 million going in some form to, I think actually 1.2 million, businesses in some type of community investment.
So, so you're saying $500,000, would you be open to $500,000 for, okay, I could be, I'm okay with $500,000, we start there. How do you feel about that, Supervisor Half? Because I mean, if it's successful, then we always
Yeah.
have the option to put more in.
I said $1 million because that will even go fast. $500,000 is probably a drop in our economic bucket, but $500,000 is better than no million. So if we have to start with $500,000, that's fine. But hopefully we would have some money in reserve so we could bring it up to a full $1 million for this first year.
So why don't we go ahead with it being $500,000 and then keeping that in mind that if it does look like it's successful, bringing it back to the board to see if we need to add money sooner if we find it's successful, which I hope it will be. It sounds, yeah, it's from talking to other communities, it seems like a pretty successful program elsewhere, so.
And we should be able on the 13th to have the additional information that Supervisor Kirk has asked for about the businesses, so bring that back as well. The next one I have is the $250,000 for code enforcement. Two of you actually spoke in favor of that. Is there any other discussion on that?
I guess I've just got a question on that. Thought we already approved that by board action previously.
We approved some money for code enforcement previously for staff. This would actually be to go out and to kind of front load the program to get to start picking up the trash and cleaning up some of those
Separate
code
of the
enforcement,
staff.
some of the abatement that would need to take place.
So front loading it, would we get those revenues back once they?
We would work through our
Actually,
normal
full-
process for some restitution, but we don't always recover all our
Tracy's-
funds.
I would say, I would caution you to not plan on getting that money back. You've already planned on getting money back through any types of fines or penalties to pay for the staff time. You will not, I mean, Quincy and I have talked, we don't think we'll have enough to get there. You're certainly not going to have enough to get staff cost of 2 code enforcement officers and another $250,000 back. And we'll be bringing some fees and discussions to you in the future. But remember, just because you levy a fee or a fine or a penalty doesn't mean we're going to get it either, and that's the other
Sure,
thing.
you could, I would support 250, but I kind of want to know from Quincy how far she thinks that's going to go.
I would support it.
Okay.
The 250.
Could that be, do you want us to make a commitment that we need to do this right now, or are we asking, because if we came back on the 13th with some more information, you might get either a more assertive answer, or we might want to pull back a bit.
So we will develop a plan based on what you tell us today and bring it back to you on the 13th. And obviously, whatever direction you give us at that time to make modifications to that plan will be what we build into the budget that your board will ultimately adopt.
And I have a suggestion about that. It was kind of implied in what I said, but I'll state it clearly, that we need to get the code enforcement officers in place, and we also need to get our codes, our ordinance codes that are faulty, beefed up with the proper, fines and what happens because they've been stripped in past years. And so that all needs to happen before we could start the enforcement. So it's not going to happen right away. But I'd want this money to be there for when we do start the program.
All right, moving on. Next one, obviously we heard support for fire. The number that was brought up was $1 million for a fire engine. So we had one person specifically state that they wanted that $1 million for a fire engine. We heard also that we would support it, but we want to wait a little bit. Do we have any other discussion on that one?
Yeah, well, I have in my budget here, there are 2 requests that I have for the 30% going to fire as our number 1 priority, and I think in the strategic plan, about 10 million is what they're needing for apparatus and equipment to catch up. So 1.28 of that going to Tuolumne County Fire, which is ballpark area. Potentially that could go to a piece like a Quint, which might be needed for some of the new developments coming out, or a Type 1 engine. And they can figure out, I think, where best that needs to go. I did want to put in a request in particular, as we're all aware, anybody reading the Union Democrat, the Columbia Fire District. It is a very busy fire district. It has a 1 square mile area that's very limiting. Gold Springs, for example, is not in the Columbia Fire District. The closest responding county engine is out of Jamestown. That's a very difficult situation. So I also have in here a request to be able to support this local fire district that does, I think, support county fire operations and safety for $350,000, which I would hope would be most of what they would need to help replace one of their aging Type 2 engines.
Well, but we're talking about county fire, $1 million for a fire engine. And so we need to see is if there's support for that right now.
So I would say, okay, support $1 million, but not maybe necessarily specifically for an engine. Maybe ask the chief if he had $1 million, well, maybe he'll get 2 Type 2s or whatever. So maybe the funds, but we'd like to hear from him what he would use that $1 million for.
So $1 million for fire equipment.
So $1 million to fire in general, and then have a discussion about how.
Yeah. See what he would, maybe he'll get a couple
I think
engines.
it should be a 1.6 million.
I concur with the 1 million.
Okay. Yeah, I think that's better, is leaving it vague so that, they will tell us, rather than having us tell them what they need, they tell us.
All right, next one, it was the GIS software. 2 people that mentioned that.
So that's the 60,000?
Correct.
Yeah, it's 35,000. I believe I clarified this earlier. It's 60,000 because it's grouping the GIS system and the digitizing scanner upgrade that's also needed together.
Yeah, that did include the large printer scanner for survey, that number.
The 60.
For survey. Would they use that during emergencies, during fires, during?
That would be different than the GIS printer for maps and whatnot. So it would be large documents though.
So do we want to consider them together then, or separately?
What would you prefer?
Well, I'd support just doing both the 60,000.
Okay.
I mean, 60,000 is not a lot. I just want to try and be as fair as possible. If the GIS I support because of the safety element, the printer thing, I don't know if I heard if they can figure out a way to budget that in, or if that's completely off the table. Anybody know?
That printer scanner would also be used for scanning documents that exist in paper form right now in the surveyor's office. So that's part of the eliminating space in the surveyor's office. Being able to digitize those files.
Yeah.
I see somebody running up.
If I'm not mistaken, when I was OES coordinator, we had GIS make the big maps. So they are used in cases of emergencies.
Yeah, so the large format printer scanner is also used by the Community Development Department. So we don't allow plans to leave the building. They'll come downstairs and then get them scanned and printed there. So it's for the very large, and you can make the GIS maps as well.
But between the departments, could you guys come together and budget and make it happen, or do we need to use ARP funds to get it?
I think that we'd have to cut something else out because both of them are general fund department divisions.
So I didn't vocalize support for it, but I do have it in my recommendations for both of those. So I support those.
So, Kim, before you go, how old is the current printer that we are using?
I think Blossom's holding up 8 fingers.
Okay. How long do they typically last?
That's not a,
Because that's kind of a specialty item, right? It's not.
It is,
It's not
and-
your grandma's printer.
It's not, and
Okay.
apparently makes some really odd noises.
Okay.
At times it has to be shut down and reboot.
And if it were to break, we'd have to just go out and buy a new one right then and there.
We would,
Okay.
or else we would just not be able to provide a service.
Okay.
And
I
if
think-
if it broke, how would you pay for it?
I'd have to ask for a loan.
I think the most important
She'd be standing there
question.
and asking for
I
$30,000.
think the most important question is, we've heard that the software, the GIS software, is going to be out of date and not able to be used. Assuming you could get the new software with the licensing and everything, would it be compatible with the old printer, or do you need to also get the printer to go with the new software?
They're two different things. You don't need.
You don't need.
No, they're individual, so.
Okay. Well, I'm okay with both. So.
Yeah, I'd like to update mine from 30 to 35,000 to 60,000.
Okay.
All right, moving on. The next item on the list was the $250,000 for broadband.
And that would be for a match,
Just setting it.
for a match. Yeah, and if we don't need it, we don't need it.
And there's so many things going on with broadband. What is it for?
So, California legislature passed a $6 billion package, of which we're going to get lots of money regionally for broadband, especially in the last mile projects that are going to come up into our neighborhoods and complete broadband where there's not been some. There will probably be partnerships formed, whether they're public-private partnerships or we just hire an ISP, an internet service provider, to do the last mile. That's another thing. But there's a lot of possibility for public-private partnerships where we would be involved with the infrastructure, where maybe we'd do the paperwork and the ISP would do the build-out. A lot of times for these kinds of grants and support money, there is a local match that's required. We don't know right now if there's going to be a local match for any of those funds, or the potential for other federal funds that are going to come down the pike for broadband. But it would be irresponsible not to set aside some money for that in the case that we do need it. And then if we don't need it, 2 years, 3 years down the road, we can reallocate it to something else, but I don't want to be caught short and not have the money if it makes the difference between whether we get a project or not.
The other thing I would just bring up is that we will look at the funding source for the state dollars that are coming. If it's coming from federal dollars, we would not be able to use this to match it. So we would just caution against that.
So I'm hearing potentially projects or no project if we get the money. Okay. So I like the idea that we can maybe have the money back if we don't use it. So
And again, just to remind your board, if the money that's not allocated, it still sets aside until your board tells us what to do with that. So as long as it's not allocated, your board is free to give us direction on that in the future if there is a match that comes up that we have to come up with.
Obviously, if there was a $25 million grant that required a 10% match and we could use some of these funds to do that, then that's a great idea, but we don't have that plan yet, so I'm kind of a little hesitant to take that money out of, that we could potentially allocate to something more immediate, or if there was an emergency where we might need,
I'm in the same boat as that. If we had a specific local match for a grant, we knew, but since a lot of this is coming federally, that's not allowed, so we're looking for something from the state, and we're not sure. I think we're doing a lot of progress on this right now, but without it identified, it's hard to allocate for a hypothetical. Really quick, one I don't know, point of clarification or order. I did print up a list of a lot of suggestions. I didn't go through every single one to vocalize it, but I'm not sure that any of these have been brought up yet. And a few of these items have been things brought up by an individual supervisor. I thought we were kind of going on the things that we've had two people talking about, like as an idea. Just wanted to make sure that this was being considered as some of that. I just didn't feel the need to take up another 10 or 20 minutes and go through each one.
Are you asking me to go through every item on your list?
No, just maybe some of them.
You were going to talk about the local organizations, weren't you?
The nonprofits?
Yeah.
Yes.
Okay, well, do we want to?
We're kind of getting away from the broadband
Yeah,
question.
no, I was just saying that,
I would recommend we get through what he has planned and then we bring it back and then
Yeah, and at
more
a
items to discuss.
certain point, do you have a running tally of how much we're committing in numbers as we go along
We can add that up.
Because having to fit this all to a $5.3 million budget, it goes very quickly.
Sounds like we're right now right around $2 million.
Okay.
I think we should get through the whole thing and then circle back around,
Yeah.
how much, where we at, how much, and then prioritize what we're, because I'm not, just because I'm saying yes all these doesn't mean I'm going to be yes in 20 minutes. I want to get through the whole thing.
So did we have no consensus on the broadband at this point, or consensus?
No, I'm concerned about parking money that we may or may not have the need for. And I do understand that if something came up,
yeah,
that it would be really advantageous to have it there, but in the meanwhile, it could be used for something, and holding it for what could be a long period of time, to me, doesn't make sense.
okay.
I just want to make one last comment, and that is that our chairman brought up, we're not going to know the needs, 2 or 3 years down the road, and this is a potential need. We're expected to be long-range planners, and so we're not going to have a pot of money. It would be unlikely that we would have another pot of money like this after the ARP funds are expended. So I'm trying to think critically and what's important to our community to be connected, and I would hate to see us lose out because we didn't take this opportunity now.
So my question, when is the next installment of the next 5.3 supposed to hit?
March of next year.
March?
I'm sorry, May.
May?
So let's keep going, because.
Okay. Good point. So the next one on the list was the document management. We had one person bring that up, but it was on the.
That was one of your, on your list, right?
So
That will also help with getting square footage in the buildings if we're able, as Supervisor Goldenberg had brought up, if we're able to do all that scanning and get a real system in place, there's a significant amount of space that then would be freed up by getting those papers into a
So the
digital format.
question I have on that is showing 600,000 here, but I thought I heard that the previous effort for CDD cost us 300,000. So how did this double?
I asked for countywide, so we talk about the auditor controller, your assessor, your tax collector, they've got a whole lot of papers down there, and none of that is digitized in the way that what you can do now. Also helps us with continuity of business in the event that stuff is backed up by IT. Say the building or something were to burn, we could still get back to those documents if we needed to. So that's why it's meant for countywide, but we expect at least another 300 probably for Public Works, similar to what we did with CDD.
How
That
does
does-
Sorry, no, go ahead, you, ladies first.
That does not include the cost of actually doing the document imaging. That's just for the equipment.
For Quincy, it did include both.
So your figures right now would include actuals paying for somebody to do the document imaging?
Correct.
And it does or does not include Public Works?
It does include Public Works, that's half of it, so another 300,000 for Public Works, and then the remaining 300. And we, it could be, depending on where else, I mean, you could take, HHSA would probably be huge if they went to go fully digital. But that was meant for any other departments that are ready to step into that realm. Let's look at it and see what we can negotiate with the vendor to get that going.
Okay,
But Public Works, absolutely, so we can look at that space that they have up there, because it's significant.
So I would be in favor of just doing the Public Works portion now, and, because that would buy us at 1,200 square feet, I believe, and then we can look at the next round of ARP, perhaps to do additional, but I'm just trying to spread out our choices here and get the most bang in different areas.
For me, I'd rather see this go in another place. I think it is a good idea, but I just don't think it rises to the level of a lot of other priorities right now.
Yeah, and I'm kind of there too, because a lot of the things we've talked about so far have been very public facing. They're things that will directly touch people's lives. And although I'm really into saving money and doing things more efficiently, and this I think would accomplish that. It's not something that I think will be felt very strongly in the community. And frankly, I am not fully in understanding of what this entails and how it will increase the efficiency of our operations. So I'm kind of not, I don't want to dedicate $600,000 to it if I don't understand it.
Unfortunately, if Quincy were here, she would be able
Yeah.
to tell you what that has done for her staff.
I'd
but-
want to look into it more than we could get into right
Yeah, and
here
you'd be
before.
able to talk to her, but as
Yeah.
I said, they were able to access all of their documents remotely and also send those to staff so they could get them, to the public or constituents to get them electronically. But we can have her come in on the 13th and talk to you some more about that.
So it sounds like we do not or do have
No,
consensus.
I definitely see efficiency, and I love the idea. I'm all about technology. When I think of ARP funding, I don't think of document management systems.
Okay.
So.
All right, so that's a no on that one at this point. So we're moving on. The EOC upgrades were mentioned as well. That was by Supervisor Brandon. Did anybody else have any input on that?
What is the EOS? Is it, we're talking about the car?
The
or the
parking lot and the
communication?
AV
I'm
stuff, yeah.
I had recommended at least the parking lot, because that I think is, it's pretty critical if we have an emergency and we can't fit the vehicles we need to in there. For $75,000, that seems pretty targeted. There was also a much larger proposal for the AV system. I'm still just skeptical on that, to be honest. It's not that it wouldn't be very nice, but I feel like we can get along without that at this point. And I think that was something 300,000, so.
Yeah, and I'm in the same spot. I've spent a lot of time in the EOC, and, there are problems with the AV system that I think we could probably find a way to get around it, but the parking lot for the usage for both emergency personnel during an emergency and the public when there's some kind of community event there that involves the public, there's not enough parking, and there is available space, we just aren't using it. And so if we can do it for $75,000, I think that's worthwhile.
I agree with the parking lot idea. We're not going to be able to get grant funding for the parking lot, whereas we might be able to get that for the AV equipment, and if not, we can revisit it next year with the remaining funds.
Okay.
I'm the Lone Ranger. I don't think of ARP monies for parking lots, so I'd say no, but there's a majority, so let's move on.
All right. Next
It's a
one on the
public
list
parking
was
lot, though.
animal control. I believe you brought that up as well, Supervisor Brandon.
Yeah, there's a number of, I think, pretty small investments in animal control that we can make. There was mention of the laptops that might be able to be covered, which, thank you, Sheriff, appreciate that. There was also some issues, so animal control, as an example, doesn't have the funding to be able to do vaccinations for animals coming in. They rely on sanitary cages, sanitary floors. Infections like that can kill a lot of animals, liability issues. So what I would request is $17,000 for the sanitary cat cages. They're getting kind of overwhelmed right now. That will help, I think, with long-term liability, and it is an issue. Also, to put some aside in addressing some of the critical staffing issues that we're facing with vacancies and whatnot, and whatever format that takes. What I have in my budget here is $71,500. I know there were a few other requests for a barn, the outdoor shower. I think there's a few needs that we can meet there, if not everything.
Well, they're asking for 54, and that covers, does that cover everything you meant? I mean, short of the staffing.
Yeah, the staffing for me was putting aside 50 of it, so it,
So then what would be the cost without the staffing?
the other minus the laptops, I only had the cages. I did not have the shower,
Okay.
the outdoor barn.
So then the 17?
Yeah.
Okay.
But if we were not including the rest, the shower made sense. I don't want them hosing themselves off in the back there with a garden hose. It's not right.
I concur with the shower. And also, didn't we, I don't know if it ever got costed out, but recoding the floors,
Mhm.
did we ever get pricing on that?
Unfortunately, Kelly Schroeder, Animal Control Director now. I was the Ag Commissioner earlier, switched my hats. I did ask back in May for a quote on that, and unfortunately, I have not been provided one. And I asked again last week and still do not have a quote for the floors.
Any guesstimates?
Sorry,
Yeah.
yeah, I have no idea.
Okay.
The issue there, I mean, it's concrete floors, correct, that are glazed. And what you had mentioned to me was that they're basically cleaned with pretty harsh chemicals so regularly that it wears it down.
Correct,
And that's
yeah.
the risk of infection and sanitation becoming a big issue.
Yes, yeah, because we constantly, fortunately, because we don't have the funds to vaccinate the animals when they come into the shelter, we have a very rigorous cleaning program to keep disease down. And fortunately, we have not had any disease problems for that reason. However, it does destroy the floor because we are using pesticides that kill germs and viruses and bacterias to keep the animals safe. So it does wear down on the facility, constantly cleaning it like that. So the protective coating on the flooring helps with that. And part of our hallway is covered, but the majority of the shelter is not. But unfortunately, it's not in my wheelhouse. Wouldn't even want to hazard a guess. I'm sorry.
So I was writing down notes, so I don't know if I caught all of the floor situation, but I think we should put money aside for the laptops. Hopefully the sheriff can work with her on a grant to get the laptops, but I would support the laptop, shower, washer, dryer. That's just gut reaction. I don't know if cat cages are, in my mind, ARP type funding, but I think those issues are safety issues for our staff. So that's kind of where I'm at, but
Okay, so that's, I think we've got three different
What if we just gave them
ideas here.
an amount?
so. I mean, can we do that?
Yeah, we could
Just
give an
say 20,000. See, I prefer it being, I get that, but I would, for the sake of being responsible and being able to answer to the taxpayers to say exactly what these monies are going to.
Maybe an amount, but to the things that have already been
Yeah.
presented to us.
Because we don't know what it's gonna cost to put a shower in there. We don't know what the wash and dryer, that cost will be minimal. The shower, we don't know what that's gonna cost. We could try to get some rough numbers brought back on the 13th if you would like that. and
So
just
let's do
build
that.
Back in.
Let's
So-
look at what the costs are going to be and come back on the 13th and not make any commitments right now.
So
Is
we're
that-
looking at a
is that good?
shower, just if I can get some clarification, some consensus. So we're looking at a shower, the washer dryer that was spoke of, the flooring. Anything else for animal control you want us to?
laptops
Laptops?
Sheriff Pooley, do we have a commitment on those laptops that they're not going to need the funding?
We're kind of putting him on the spot here. He's going to
Well,
have to
I
reach
heard
into his
yours.
own wallet there if thing doesn't go through.
So we would propose we do the same thing that we did with the ambulance company, is provide the laptops, but I need to double check to make sure the grant says that that's okay. I can let you know right away. But I don't see it being a problem.
So why don't we just cost it all out and then come back on the 13th.
I
and then
think we
can
should
decide.
include the cat cages, so.
Okay.
One for cat cages.
So, yes, so just cost everything, and that way we can decide then. Because if we don't know what the costs are, then it makes it
The
harder.
mouse cages and
Yeah.
the hamster cages.
All right.
Okay.
And then, so the
Same with
last thing
feral
that,
cats around Jamestown.
the last thing I have on the list here was not brought up by your board, but was brought up by staff, was the generator for the probation department. Did your board want to have any discussion on that?
Personally, I
So-
think we should look for a grant.
Program?
So you're bringing that up, I take it because is that a pretty significant need?
It's a
That-
critical infrastructure. It's where our probation folks work. Again, the lighting is an issue. The continuity of our operations is important for probation. They're an integral part of the criminal justice system. We do know that, we are expecting some more PSPS shutdowns this year. We don't know if the time period or the mass blocks that were shut down are going to be the same. But it's going to continue to be a problem, and we don't anticipate that ending anytime soon.
And I'm sorry, I'm struggling to find where that is.
I don't know.
Is that not on the,
Yeah, I would estimate for that facility somewhere probably around $250,000.
okay.
Hey, just on that note, Terry was here earlier talking about, because he deals with large industrial projects. Can we have somebody follow up with him about
We
his
do, we do
generator?
have access to the federal surplus website, which I believe is what he's referring to, and so we can definitely check there to see what's coming across there. But a lot of times those are used products, and in the past, when we've gone there to look for some of those things, it may be different now with a lot of the surplus items coming back from overseas. But it's definitely something we can look at.
Just, if private
Yeah.
people are doing it, there's a reason.
Well, and you raised some good points that, we might, there could be more PG&E money for these types of purposes, and that would obviously be at the top of the list. And we don't really know what the total cost is going to be. These things are always crazy more expensive than you think. So, I don't know. Do you want to make a commitment now or
And we,
come back
again,
with a proposal on
we
it?
do know that we'll be getting another PSPS allocation for generators sometime in October. We just don't know what that number is yet either.
And how much did we get last time?
The last time was 180,000.
So then the benefit to deciding now would be that we could get to work on that project right away. And if there is additional PG&E money, we can use that to backfill what we spent. And then that can go back into the,
I don't know that we'd be able to backfill behind it.
Okay.
We could get the project ready and get a shovel-ready
Well-
project, so when the funds do come in October, and we know what the requirements are under that fund, we can decide at that point whether or not we can use PSPS funds, or if we would have to find some other funding source. Because there
Okay.
were limitations last time on where the funds, how much of it had to be allocated to certain areas.
okay. So, just so I understand, if we spent money to buy the generator with ARPA funds, and then it ended up, we got money through PG&E, the ARPA money's already gone, and we would have to use the PG&E money somewhere else.
Which we have plenty of places I think we could use that.
Okay, see that, I would want to wait until we knew what we were going to get in October. And then maybe we could use a portion of ARPA to backfill.
I see a lot of head nods there.
Okay,
Okay,
It's not that far off.
yeah.
getting closer.
Yeah, I think this summer is kind of going quick.
Okay, so far from what I have consensus on is the space needs study, the RAD card, code enforcement, fire apparatus, GIS software with the printer, the EOC parking lot, and then we'll cost out those things for animal control. Is there anything else that your board would like to discuss?
I wanted to express support for Chairman Campbell's idea was in some of these specific places, volunteers, community groups, grouping that into a 500,000 community group grant fund for micro grants to various organizations. I think that's a good way of going about that and getting more information through an application process.
And just to give the board an idea of where we're at right now, not knowing what those animal control costs are or the salaries portions, which we'll talk about separately, and we've already committed $350,000 in the recommended budget from ARPA funds. So we're right about $2.4 million right now with what your board has directed at this point.
I'd like to make a suggestion about that money for the community. If we do decide to do it, that's going to be quite a bit of staff time to figure out who gets what, and I would suggest that we create a fund with Sonora Area Foundation and they decide. That's so it take the administrative part off of our shoulders, if that can be done with
That was
with
going
this
to be my
kind of money.
question. Can we do that?
Yeah, I believe the guidance does allow for us to do that, correct?
So how about we leave it a little more vague? We look to you to come back with a recommendation on the 13th. Are we pretty okay with $500,000 for this type of enterprise, small grant type idea? Okay.
Is it specifically to small grants?
Right now, what I have is nonprofits for 500,000.
Okay.
So
No.
is what I heard earlier, is that still where we're at?
I think it's a good idea to approach Sonora Area Foundation if we can offload some of this, and they're already good at that already. I would recommend we have some guidelines. Again, yeah, if we're saying grants, okay, this is the range, these are the types of organizations, a little bit, so.
If
But
we
should
if
definitely
we
reach
set
out.
the fund, we can set the parameters.
So that's something that we could look into and then come back with a recommendation, hopefully on the 13th. Correct? Okay.
Yeah, just
Yeah.
on the parameter, I would like to know what those parameters are.
Yeah, and I think there's a lot
I
of.
mean, I
good-
don't want to control Sonora Air Foundation, but
Yeah.
there's a few, I could see that.
So what we would do is we would
Parameters,
build
give some
all of this cost into our presentation on the 13th, and then at that point, look for some direction from your board on what you would want those parameters to look like. So, and then we would work with the Sonora Area Foundation to set that up.
So if we ended up doing the 500,000 with Sonora Area Foundation, then unknown a little bit on the animal control stuff, but it looks like we're right about 3 million
Correct.
committed. Okay.
Yeah, 2.9.
Yeah, and with the animal control on top of that.
Anything else?
Okay.
Yeah. Are we going to talk about sheriff,
So,
ARP?
well,
one way, just based on what I have sitting here, I would recommend us putting some money aside for future bargaining. It does not have to be specific, but again, it's very easy to allocate this and then look back and say there's nothing left over, which is just my concern with this.
Again, right now, we're about $3 million, which your board has tentatively allocated, leaving the balance of that for other projects, including bargaining and other projects that might come up in the future. So that would be a discussion we could have at a future date, and then hold the bargaining discussion in closed session as we're required.
I'm comfortable with that.
I get it, because we got to talk closed session bargaining. What I don't want to do is commit, I guess we're not committing this money, we're just committing to this conversation on August 13th, correct?
Correct.
we're committing to have a conversation about it.
Okay.
And go through the bargaining process.
Correct.
And there is the balance of the
Yeah, what's the
5.3
balance?
still left.
Correct. Right now, we're roughly about $3 million.
$3 million balance?
Yeah.
Right.
Okay.
That's not 3 million balance. We got
Oh,
about
sorry, yes.
2.
Correct. So of the total allocation, you've only given us direction on about 3 million.
So we got
2.3. Well, we spent
That includes the
code
350.
let's call it 2 million. That,
3 million, yeah.
okay.
Okay, for the first 5. All right, I'm going to shut my mouth.
Well, so I just want to say, for a number of these discussions, my proposal would be to put 1.4 million aside for future
I missed
bargaining
one.
efforts with that.
I did miss one, I'm sorry. When you're done.
Not necessarily specific to any group, but I think we need more than just we're going to address this in the future. I think we need something
See-
firmer than that.
And I was just going to bring up roads, constituents number 1 or 2 issue. I don't know if there's any love for the road proposals, but
One of the things that, and I think was brought up earlier, is we do know that there's additional funding coming through PILT, SRS. We do know that there's additional funding from the feds for infrastructure. They haven't set that information out, how it's going to impact our county at this point yet. We don't know what those numbers are looking like just yet. So that's just something to consider, that there's other buckets of money coming for infrastructure, homeless, and some other programs as well, that is not part of this funding that we have.
hopefully, I just,
Yeah.
We just
The
don't, we
money's
won't
not
know
there right
probably
now.
closer until October what that's gonna look like, once the federal budget's finalized.
And Supervisor, could you bring up a good point? I mean, with the things that I support, I would be saying, give all this money to roads if it were not for those other funds that you're saying. Because these monies can be spent in a much wider variety of ways, but like PILT, secure rural schools, I mean, it's a separate topic and I won't go into too much on it, but I'm very firm that those monies are infrastructure type monies. And so since we see that money is coming, it makes it easier to say that, roads doesn't need to be as prominently featured in this because these are monies that are more community focused on some of these other things that generally don't get access to grant funds. So, if that makes sense.
I'd like to go back to speak to Supervisor Brandon's request because we left that hanging regarding setting a set amount in bargaining. I think we've shown here, today during the session that we had pretty good support, wide support amongst the board for the sheriff and trying to see what we can do to fix those problems. And I think it becomes a bargaining area, and we've got $2 million that are not yet committed. So I'm not in favor of committing a set amount because we have unknowns still.
Okay, so do you need any more direction from us?
No,
You probably have more than enough to go on between now and the 13th, I'm assuming.
We've accomplished our goal and got some clear directions, so thank you.
Okay. All right. All right, well, thank you very much. Now, we didn't complete our last closed session item, so we're going to go back into closed session. I'm going to look to our board clerk to read that for us once again. It's item number 5.
Item number 5, closed session, conference with labor negotiators, Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, and Ann Fremd, Human Resources Director, Authority Government Code Section 54957.6, all bargaining units.
Okay, now, I did ask for public comment, but I'll ask again if there's any public comments on item 5. Yes.
My name is Sandra Asquith, and I'm from Twinehart, California. My question is, listening to the conversations going on here today, it appears that the county is going to be going digital to be able to share amongst the people in the county all of the paperwork that currently goes on. If that is so, then how can you not support broadband if you're trying to go digital within the county? It seems to me that you should be able to fund, or at least set aside, broadband if you're going to go digital. There are so many people in this county that don't have access to internet. How can you go digital if you don't have broadband? Thank you.
Thank you. Is there any other public comment? Okay. All right, so we'll go ahead and go into closed session. Do you expect us to report out? Okay. Thank you very much, everybody.